Hold on, I'm gonna poke one little. Don't spray us. Might be that quiet. Yeah, it's gonna come out. It's like egg yolk. Oh, yeah. Sorry. I have noticed that Angela's cysts are pretty liquefied, so I'm gonna try to see if I can aspirate some of the fluid first, deflate it a little bit to make it more manageable and less messy.
You okay?
We're okay, yes. Oh, we're okay.
I think she was asking me.
Oh, sorry. It looks like orange juice.
Oh, no way.
It's a mimosa.
It's a mimosa.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
Okay, you ready to get this thing out of here? I feel like you are.
Yeah, let's get it out.
I'm just kind of feeling around with my fingers just to see, explore like where this bump is. I think it's just still just right under here. I'm here with Gabe, who's an extremely nervous patient, so I'm trying to talk him through this, making sure he stays nice and calm. I think that this is probably a nice, perfect, just ball of a lipoma. Hopefully I can just pop it out in one nice, simple pop. I'm just trying to be very gentle here, because there's just cute little veins that want to look at me and say, you really want to mess with me? I'm not trying to play with them.
Yeah, it's like cellophane wrapped.
Yeah. Every lipoma looks different, so really when I take a peek at this one, it's got some very interesting features. It is intertwined in this sort of cellophane wrap. It's really kind of keeping that lipoma intact, but there's also this really big blood vessel there, and those always give me a little pause, and I try my best not to sever them when I can. So I'm trying to slowly peel away these layers of cellophane. He likes you. You're a good guy, though. I could see why.
It's very impressive.
Yes, it is.
It is impressive looking.
Have you ever bought a product that is shrink wrapped? And so it's wrapped in this sort of cellophane. That's like what this lipoma is like, because once you kind of cut into it, then you see it expand. It really got big. This was a lot bigger lipoma than it first appeared. You know what it's like? Have you ever bought those bean bags that are from like China and they're all stuffed really tight in this airtight bag?
Yeah.
And then you open it and it's like, oh, it's expanding, it's getting bigger.
Yeah.
And then I feel like I could twist it and it will come off. It's like a bolt or something. Come on now, dude. Just come to mama here. Just like that. He's off of you.
Yeah?
Yeah, he's off of you. We got it. That was bigger than I originally thought. It's a football.
Really?
Yeah, it's a football. I'm so proud of you. You ready to see what it looks like?
Yeah. Wow. That's so awesome. I look in the mirror and I just see a flat spot. I see symmetrical shoulders. It's just a great vision right now. My shoulder's like this. It's been so long.
This was the top of it, right?
Holy smokes.
See that? This is like 3 or 4 layers right here.
Any side effects, you think, or
Of us removing this?
yeah, what possible side effects? But it won't go back or anything.
There's a chance if there's some deeper component to it, there's probably gonna still be a little bit of it left.
Okay.
That there's like a deeper component sometimes, but I'm trying to keep this pretty superficial here.
Okay.
I'm here with lovable Lorne, and he's got these neurofibromas on his face that I know that he hates. This one here on his neck is a plexiform neurofibroma, and it's almost like an iceberg on the surface, and what could be going on underneath, I'm not quite so sure. And Lorne is really smart to ask me about this. There's still neurofibroma tissue here. I can see it. And I'm sure, like, if we sliced into you like a loaf of bread, there'd be quite a lot more than average neurofibroma tissue in you. So, you know, you could also be just going into another one, you know?
I trust your judgment.
Well, you're gonna be able to see the results in just a bit here, so. Okay, that's one down. Lorne's concerned about side effects, but he doesn't have to worry because I think we removed it enough to really make it nice and flat in the area, and it didn't look like I encountered any big, important vessels. Now I'm gonna remove the other one, the cute one. You're doing great, but everything looks good. You doing okay? Okay, good. Good, good, good. You're doing awesome.
That was very painless, thank you.
Oh, that's good. A little buzzing sound you're gonna hear. Nothing should hurt, okay? Just stops little baby blood vessels if they're oozing. Sorry, it smells like bacon or something.
Getting hungry, actually.
What?
Yeah.
Are you about to ask us out to dinner?
Okay.
He's pretty sharp. He made us feel like we're asking him out to dinner. I was able to remove Lauren's super cute little chin baby bottom, and I think he's gonna look fabulous. I can't wait to see the results. All right, you ready to take a look?
Yes, I am.
And hold your mirror up there.
Oh my God.
A little easy right here on the
They're
bottom.
both gone.
Yeah, so this is swollen, that's all, okay? Just swollen, a little line there that will take out the sutures, and you just have a fine line there.
Okay. I am so happy right now. I mean, seeing myself in the mirror for the first time is taking all my control not to start crying. Wow. I am the happiest I've been in a long time.
It's the last time you see your dad with this, hopefully. You okay, right, sweetie?
I'm good.
Mr. Rubin, okay. Good. You're gonna hear a little buzzing noise because I'm just gonna stop little baby blood vessels. I'm here with Reuben, who is a big, tough, scaredy cat, and Bella, his daughter, who is so sweet but really keeps him in check. I'm about to tackle this lipoma on the back of Reuben's head. I am anticipating a lot of bleeding, but I'm going to zap every blood vessel that I see to help to minimize this.
So it's totally visible now, right?
Yeah. Right? Does it look like what you thought it would? Mm-hmm. Yeah.
Uncooked chicken?
Does it make you hungry?
No, not really.
Good, good. I'm gonna squeeze you here, Daddy. See if it's ready to pop. This lipoma is looking good. I mean, I've never had a lipoma pop out whole on the scalp before, though, so I don't have a lot of faith that this lipoma does not have something up its sleeve. Sometimes they're like solid, and they would come out whole, but I think this one's maybe, well, a little bit, mainly. Ooh, he talked to us, too.
Those are some weird noises.
Yeah. You okay? That's mainly bumpy. See him? Kind of cute, isn't he? Yeah. This lipoma was awesome because it popped out whole, it wasn't super messy, and I got to leave this incision line short. I think Bella was really good luck. Now it's swollen because we put numbing still under there, so it's still under there. So Reuben may look like the superhero, but Bella is the true hero here. Because of her, he got his lipoma removed. Good job, Bella. Very proud of you.
Probably what makes me happy about today is being able to share it with my daughter. You know, she's been through it the whole time, and she is the driving force behind me getting this done. It was a great experience.
That's crazy. You're right about that raw chicken, though.
I told you.
Can you see it normally when you look in the mirror?
Oh, yeah.
It's just a little bit bumpy on the edges. That'll flatten down because it's just filled with numbing fluid there.
My life's totally gonna change in terms of physically, professionally, emotionally, you know, and that's a big part of what I plan to do with her. She's missed out, I've missed out. I feel like I'm gonna be back to me again, you know?
You can wear this the rest of the day if you want to. It's yours. Bye.
I'm definitely proud of my dad, and I'm happy that he feels like he's in control of his life, not just the bump is.
Okay, so I'm gonna put one little baby pinch in here, okay? I just wanted to avoid the vein, see if I can pull it out of this socket that it's in, and then decide how we're going to fix you up. I'm really planning out my surgery beforehand, paying attention to where this vein is. The armpit's pretty dark and almost like a little cave, and I don't want to nick something that I can't see, so it's much better to use my fingers and to use rounded tip instruments. Okay, and you shouldn't feel anything other than us touching you. Nothing should be sharp, okay? That's the main point. And it's a lipoma. I'm gonna squeeze it here. thought it was gonna give me a nice pop. Not yet. I'm just taking my time and making sure that we're not hurting you at all. The lipoma does not contain the vein. It's the skin that has the vein in it. And so when I'm removing this lipoma, I'm really dissecting very carefully the skin from the lipoma. It's a lot like peeling the rind off a lime. And this means getting your fingers under there and really kind of pushing gently and really trying to not damage the lipoma, but also not damage the skin. It's like attached right here. So Margarita has a lipoma that is pedunculated. It's hanging from a small stalk, which is great, but it really is positioned in one of the worst possible places. It is very close to her brachial plexus. It's like a really choice lime on a tree, and you want to cut it, but right next to there is a beehive. Just wants to hold on. Almost got it all out. It's gone.
It's gone.
So I can see the vein right here, underneath there. I removed the lipoma safely, but that big vein is still attached to the skin. So I'm going to tie off the ends and really promote sealing or closing down of this vein. And because it's closed and it's not patent anymore, your body just absorbs it. Okay. So it looks like we tied it off successfully. Just taking off that extra skin here. I really need to manage removing some of that extra skin so you can keep this as neat and as normal looking as possible. Well, let's put some stitches in there first and see, and then we'll trim the edges. The nice thing about this is it does do a natural tuck in this area because it's your armpit, you know, it tucks in there. This is a really tough area to stitch and make it look good, but I really wanted to fashion an L-shaped stitch that will tuck really well into the dip of her armpit. And I think she's gonna be really happy with this. So take a look here, okay?
I am amazed. When I first saw my arm, I just said, wow, I feel great. I'm just happy. It's gone. It's 100% better.
And look at this.
I can't believe it.
You wanna hold it? Put gloves on you. Put gloves.
No.
It's just like getting a chicken. You're cooking chicken.
No.
Pollo asada.
Pollo loco.
I'm so excited for the fun that you're gonna have.
Thank you.
Oh, you're so
from the
welcome.
bottom of my heart.
Oh, you're so welcome. So what I'm gonna do is I'm gonna put a little numbing in and let it sit for a couple minutes here, okay? Because of the nature of this lesion, although it is large, I don't like that on him. It's just important to get something like that looks like that off as quickly as possible. If you take off an entire area that you strongly suspect is a skin cancer, you're gonna get a more accurate idea of what is involved. Okay. You shouldn't feel anything other than us touching you, as you know, okay? Well, this is not a very pretty thing. You're pretty, but this thing's not that pretty.
Yeah, I told people before it was a welding accident at work.
Now you can say you were attacked by a 5-foot-tall woman.
That's right. It is pretty gross.
Just trying to be very gentle.
Yes. I'm so thrilled.
So see, there's still some substance right here. I'm gonna take that off too. The main part of Bradley's mushroom growth has been removed, but as I do that, I can see grossly that this growth is diving down deeper below the surface of the skin. And I do really want to tackle that and remove that as best as I can. But on the other hand too, that also is an indicator that this is more involved and it's really not the greatest sign to see. Let me just take a look and feel this for a second. See, it's still underneath there. Let me try to take that a little bit more there. I'm just trying to... That looks better. That looks better. All right, so I'm gonna just put some stitches like this way. Good, you did great.
Thank you. So did you.
Why, thank you. I took out whatever I could see from Brad safely, and my job here is done. Now I pass the job on to the dermatopathologist who's gonna analyze this tissue so that we can move forward here and give Brad more information. Now you're not gonna have that hamburger meat right there, right?
That's right.
So we're gonna send that tissue in. The thing is, I feel like there's a chance there's gonna be something else done here.
Okay.
You know, it depends what the diagnosis is.
Yeah. I'm ecstatic. Having this removed is a weight off my shoulders. I can do things that I couldn't because I was always afraid of banging this thing open. And I'll be glad not to be oozing and bleeding. And I'm happy that I'll be able to go back to swimming and socializing and not worrying that I'm gonna be grossing people out.
So I'll be giving you a call soon, once we find out the results and everything. This is not the end of it. We gotta just figure out what this is first and then decide what we're gonna do from there on, okay?
Okay.
You shouldn't feel anything other than us touching you, okay? I'm here with Jeremy, our friendly Texas minister. He has a bump that is just on his upper leg. There is a stalk of skin that's connecting this bump to the rest of his body, and I'm sure that is chock full of blood vessels. So I hope the Lord is with me on this one. Oh, look at that cute lipoma under there, just wanting to come out. Okay, let's see if I can't get this thing off of here. I'm gonna make a little buzzing noise here. Buzz that bottom there. You okay there, right? Mm-hmm. Okay. Right away, of course, I see some oozing blood vessels, so I want to make sure I use my cautery tool and really get them before they get out of control. You hit a little arteriole, it becomes a lot more complicated. You can't seal a vessel if there's too much liquid around it. Still doesn't want to detach from you.
Say it's hard to say goodbye to friends, right?
Maybe you should have a different mantra, a different saying. I got it off. Okay, I'm gonna take a little bit extra because I know that this area will tend to want to open up. I'm concerned about your bending, and the more you bend, the more the scar can like spread too.
You don't have to be too pretty. Nobody's gonna see it. So.
No, we want it to be pretty. This area that we're suturing up is probably one of the areas that are under the most significant tension. Imagine the crease of your tush. If you were to squat down, obviously that area stretches a lot. My goal is to leave a little bit of extra skin there so that there is just a little extra flex and we minimize the risk of suture splitting. There's a little smile.
I always try to walk away with a smile.
Well, now you are literally gonna walk away with a smile. I left him with a grin on his face and a smile on his tush. Amen to that. Is it weird to sit down? It's the first time you sat down and not have to adjust
About 4
anything.
years, yeah.
That's nice, isn't it? It's
Yes,
nice to
thank
do
you.
that.
Well, I'm feeling good. I think Dr. Lee may have very well found her calling as a doctor. My family and my friends, they've been praying that God would heal me, and he sent me Dr. Lee.
You want to see your little friend here? There's your friend. He's like a hermit crab.
Kind of does look like a crab, doesn't
Doesn't
it? So it was, in fact, the lipoma then, wasn't it?
Yeah, it looks like a lipoma. Else would kind of like
right
herniate out. You see that? And then you could stick it back in like a purse. It's on its little pouch here. You did awesome.
Thank you. Can I pray with you before you leave?
Oh, yes.
Heavenly Father God, I thank you today for Dr. Lee. I thank you for the talent and the skill you've given her. Amen.
Thank you. Can I give you a hug too?
Yes.
Thank you so much.
Thank you.
I'm psyched. and relieved that my bump is gone. I know that without my friend, I can be the best pastor that I can be. Leave people with a smile and joy in their hearts, just like she did me today.
Let's see what we got here. Yeah, this looks like a pilar cyst.
Okay.
So I'm gonna just start to try to remove this here. I try to take it out whole usually, but sometimes these ones that are bigger, they're harder to get out whole.
Okay.
So the nice thing is that you're in control. Remember, again, if you feel any little pinches, just let me know. Just trying to relax you.
I know.
Todd's bump is indeed a cyst, a pilar cyst to be specific, versus an epidermoid cyst, which really makes sense because it's thicker walled and it was able to maintain this sort of oblong shape, you know, as it grew. This thing really is as hard as a rock. I think I'm able to get it out whole, but I also need to be conscious of preserving enough skin so that I can close this properly. Looking pretty good so far.
Not a lot of bleeding?
No, nothing crazy. It looks like it's separating really well and behaving for us, so that's what I like to see. It's kind of like going to the spa and getting a massage, huh?
Never been to one.
Just kidding. Oh, then it is. It's just like that.
Okay. Now, how many have you seen of these? Look, I got.
Everybody's unique. Yours got one that really likes to stick up. I mean, you're like got tough skin, I guess. Yours was resilient. It didn't really want to break through. This tells me you're a tough one. You're a tough guy. Otherwise, everything's looking really good.
I'm actually a little more relaxed now.
Yeah, right?
I'm still worried, but Dr. Lee talked to me, and it's making me feel comfortable. Just conversing with her.
Almost got it all. Done. I was able to remove Todd's cyst whole, and he really handled it so well. Now that I've removed the cyst, my next big task is to make sure I evaluate this preserved tissue and choose the right tissue to close this so that it looks its best. Pretty much over. I'm just trying to keep it looking pretty here now. We've kind of taken what we call a flap, like we've moved tissue from the top, you know, into like a little smile shape. We're gonna make a little smile scar. I wanna leave Todd with as pretty a scar as possible, especially because this is a really prominent area of his face. You can't miss it. So I really wanna create a curvilinear scar in a smile shape because that really allowed me to preserve much more of the thicker non-red tissue. So when I show you your forehead,
Oh boy.
it's going to be puffy because I put numbing, a lot of numbing there.
Well, I
still
kind of
in
figured
there.
it would be something like
Okay.
that, yeah. But the thing is, it's not there. Holy crap.
We put a little smile on you.
Oh wow, here it's gone.
gone.
Holy crap.
That's a big deal.
25 years.
Yeah, that's a long time. Can't believe it, huh? Oh.
Sorry.
It's okay. I'm so happy for you. I'm really happy for you.
It's surreal. 25 years, it's gone. So, I don't know, it's just, it's gone. That's all I can say, it's gone. I'm happy, it's gone.
So I'm going to put some numbing here. So just a little baby pinch on the surface. This is lancing, squeezing, draining, sac removal, repeat. It's like your job was to remove staples from all these reams of paper, and you had to use the little staple remover and squeeze and squeeze and squeeze hundreds of times. Your hand would not feel very good. And so I just need to pace myself so that my hands don't get too tired. Make sure I'm never hurting you as always, okay? Got one of them.
I don't feel nothing.
Good. Why don't you look down right now and you can see? Can you see that?
I don't want him to.
Okay.
Oh wow. Yeah, that's it.
So that's one of them. We squeezed it out, and you can see how much flatter those two are. But there's a couple under there still, below that. So Steatocystomas can often feel like the seeds you see when you see kelp that washes up from the beach. It's like these little pods that hang off this vine. And sometimes it's very confounding because you will remove a couple good ones and you're like, oh, I got this area. But then there's like 2 underneath, disguised by the other ones. I just pierce it.
Get it, girl.
Yeah. What makes it hard is it's actually sometimes hard to grasp this sac wall. Removing the cyst sac means it's less likely to come back because you took it out. But it's very slippery and thin. You have to grab it really tightly and just try to snuggle it or wiggle it. It is very hard on my hands.
Oh, wow, look at that. Oh, my
You
goodness.
see? Sexy flat armpits.
Right?
See? See that sac?
Oh, very good. Get it.
There's a second one there. Or maybe it's part of it and was attached. See, look, there's another one, right? See?
Whoa. So
See that? There was another little one under there. You okay?
Oh, yeah, I'm good.
Look, another little.
Oh, wow.
They're like all connected.
Wow.
I feel like I've been doing this for hours and I haven't finished one arm. My hands are really cramping up. They're killing me and it's really worrying me because I'm not sure how many more I can do of this. My hand freezes sometimes when I'm doing this because I squeeze so hard. Oh my God, my hand just froze up. Okay. Oh my gosh. All right, you shall we move to your chest?
Yeah.
Let's do it.
Oh, yes. Get it, girl. Just get it. This is...
It's cathartic.
Yeah.
My hands are almost numb, but I just have one more and that's it.
Oh, that's a...
You just made it happen.
Wow, that's like a donut.
The cream-filled donut. Woo, okay. Done. Your chest.
Yeah,
Good
look at that
chest,
definition.
man. Yes. Okay, people, we're on the last little bit here. Okay.
Oh my goodness, the one on the neck.
Yes, I know, we gotta get that.
The
Before you
fake
go. The fake Adam's
Adam's
apple.
apple.
That'll be a nice one. This has just been a Steatocystoma storm. I feel like I need to take a hand nap. But we have this one more really prominent on his Adam's apple, and I know it's gonna make him really happy for me to take care of that. So I'm just gonna not listen to my hands screaming and just do this last one. Almost got it all out.
Yeah.
Done.
Wow, that's my Adam's apple?
Can you swallow?
Oh my goodness.
I think these are gonna heal spectacularly. Not only is he gonna look physically better, he's gonna feel so much better mentally. And it's really gonna up his drag performing game. Look at how fabulous you look. I'm just so happy for you.
I'm like 2 chest sizes smaller. I just got a reduction.
Yes.
I am so excited. I haven't seen my chest since freshman year in high school. I can live with the scar, but I just could not live with these cysts anymore.
I really feel honored to know you.
Aww.
And just like how much you're giving to the world. So I'm really happy
Thank
that
you.
I get to participate in your life, really.
Now that I've gotten this procedure done, all those limits that I was telling myself I can't do based off of my skin, I no longer have that. It's gonna build confidence, not just within myself, but is in the characters that I portray, because I'm not gonna have to hide everything.
Trying to decide which one I want gone worst. I think that one.
I would think so. This one is like out there. Almost got him. Almost gone. All right, we got our little friend here. That's a pilar cyst too, I think. You're doing great.
Feel better already.
Oh, good. The one that we removed on her elbow, it's a pilar cyst, just like I said. Now let me move on to the more pronounced bumps on the top of her head. Just pushing on you. Okay, I'm gonna turn your head to the side. Yeah, exactly.
Did that one come out in one piece?
Mm-hmm. They look like cute mushrooms, and they come out pretty easily. And that gives me the time to be able to work on the ones on the back of her scalp. And they're really in a cluster. I think they're gonna be a lot harder to remove. Okay, let me see now. Okay, there's one down. Put these in some nooks. That was a little booger.
Ow.
Oh, sorry.
Ow, ow.
Oh.
Yeah.
Are you okay?
Not really. I feel that.
Okay, I'm sorry. Right there?
Mm-hmm.
I only have 2 more cysts to go, but they are mashed down. They're holding on to Amy's scalp for their dear life. They are stuck. Sorry, you hear that sound more so. Is it hurting you, though?
No, yeah, it hurt.
Do you want me to not do them? You okay?
Do them. I'm willing to put up with any kind of discomfort just to get them off my head.
It's just like he's stuck at the base, and I'm trying to get to him. That was the biggest one. Okay. This is the last one.
Hallelujah.
It's like at the crux of your neck where it bends. So I think it's tucked in there, you know? I do my little suspension sutures. There is one lone cyst that is really proving to be difficult. It is wedged in there. So I like to use a technique that I call a suspension suture. If I take a needle and thread, essentially, a suture, and I pierce through it, I can use the suture as a pivot point. So I can lift it up so I can use my tissue scissors to really tease out underneath it. I am on a mission, and no cyst can resist me. Okay, got him, got him, got him. Got him, got him, got him. There you go. Woo, okay. The triangle, or quadrant, as it turned out, we got it all out, and I'm pretty pleased with the results, and I hope Amy will be. This is the one on your arm. What do you think's inside? It's skin. Just skin that has shed into this. See how thick the walls are?
Yeah.
That's the elbow. This is the other one that was a little bit older too, right, on the head. It's a little bit darker. It's a little green. 35 years of wet skin cells tucked in there. You can take a look. I know it's hard to see in the back, but at least you can kind of see in the front.
Beautiful. I feel fabulous. Each one that came off represents something that I'm releasing. Insecurities, judgments, and now I can learn to let them go, and I'm gonna show the world who I am.
Make sure nothing ever hurts, like I said. I'm here with Jason, who has this pretty big growth on the back of his neck, which is a lipoma that does extend down the side of his neck, and I'm not really sure whether I'm going to be able to successfully remove that portion because it's in a very dangerous area. So we'll see. Yeah, you got like little finger projections in here. Let's see how well they want to come out of these little areas here. Right away, I see the lipoma peeking out, which is great news because I know it's superficial. However, this lipoma is in little pieces, so it's really like a laborious process to pick this out. It's coming, it's just, man, it's like peeling wallpaper. Just try to use a little gentle tug on these because I don't try to use anything sharp because I'm trying to just not shear anything, but trying to ease it out. I mean, this is just like a pain in the butt is what this is right here. A little tug on the higher part because I see a little piece here that's wedged in here. I'm seeing this piece that looks like it's intact. I can see that it projects down into this posterior triangle, the side of his neck, which is an area that I'm trying to avoid, but I'm seeing one little edge of it, and I really am going to try to tug at it lightly and see if the entire thing will release. It's like you feel it kind of coming out, and you're like, please don't break, please don't break. You gotta just let it slide out in its own time. Have you ever heard that song, Wiggle Wiggle? That's what we're doing right now. Look at that piece. That was I think that piece right there was in your posterior triangle. Look at how flat he is right there. Wait, before you do it, that was where it was right there. I think that's good. Feel that, you don't feel anything in there. I think we eased that out, which was like the most important to me, like in terms of like danger. So now that that feels good, we're like rejoicing. I think we got it all. And fixing you up.
Okay.
All right. It really was miraculous that the part that I was the most worried about slipped out so beautifully and easily. To me, that was a home run. But you can hold this.
That's a huge difference. I'm happy, excited. I mean, it's just such a relief, you know, and I'm just so grateful. And, you know, my cheeks are gonna be hurting from all the smiling.
I'm here with Chanel, who has a lot of cylindromas on her scalp, which are a more rare tumor that we see here. She's got many of them, and they're all a little bit different, so I'm really gonna have to figure out what to do in each case as I go along. Just wanting to see whether I or scoop it out. It's just that this one's not gonna be in a complete piece. So I'm trying to preserve some of that skin on top. I wanna make the scar as small as possible. I don't want to get it all. I think I cleared that out. One down. I wanted to keep the incision small because it's a noticeable area. So I had to pick out the cylindroma in pieces. Now let's move to the right side of your head. I think that some of these are run a little, you know, they're under the skin too. It's like iceberg. You know, not a big iceberg, not a big thing that's underneath. Right, that's it too. So let's see if we can get all that out. Looks like regular fat, which is good. So my whole goal here is to obviously take these off completely, but also leave you with as nice of a scar, you know, as least visible of a scar as possible. 2 down and 4 to go. Next, I'm gonna tackle the 2 on the top of her scalp. Let's do the little one first. I don't know if you've also been kind of holding off doing this because you felt like, you know, someone may have said you had to shave your head or whatnot. That's what some people get scared off of, you know?
Yeah.
So. Still okay, right?
Mm-hmm.
Okay, now. Doing awesome. Maybe I can somewhat pull it together. The smaller growth, I'm gonna leave open because it doesn't go down too deep, so it should heal rather quickly. But this big mama, I don't want to just let a big wound like that heal on its own, but the skin is too tight there. I can't close it all the way side to side. So I choose to close it partially, but at least it's a smaller area. But you also have to be careful on the scalp when you move, shift tissue around, because it actually will shift around the direction of your hair growth. I don't want to give you cowlick where you don't really have one. Feels tight, huh?
Yeah.
So I think that makes it smaller at least. That's better. Let's move to this one right here. This one is the furthest back on your scalp. I'm gonna make this like a little split thickness skin flap. I'm trying to just take off the actual cylindroma pieces and leave some of the tissue on top. So for this one, I took off what I believe is all of the cylindroma underneath the skin, and then I used that top layer of tissue to just flap right back onto this area that we removed. Okay, guys, we're on the final stretches. What is this here again, guys? It's like the frontal here. Is that it?
Mm-hmm. Yeah.
Oh, okay, good. Okay, last one here. You're okay, right?
Yeah.
If you feel anything here, just let me know. That heal on its own. How you feeling, okay?
Yep.
All right. I am going to let this one heal on its own because I think if I were to close it, it's gonna leave a much longer scar, and I think it's gonna heal in really well. And it's gonna, you know, you're gonna have a tiny little bit of a hair loss there, but it's not. It's gonna be like smaller than it was. I've decided to let this heal as an open wound. A lot of these areas that heal, they kind of constrict and shrink down to maybe 75% of their size. But obviously, the bigger the area that you have that you let heal secondarily, the more chance you have of a larger area of hair loss. So I think that what you have is Brooke Spiegler. Part of the things that we see are cylindromas. Okay. Working with Shaw now makes me actually suspect that she might have a congenital condition. It's called Brooke Spiegler. I have seen that before, and these people typically have growths in the scalp, on their nose, and various other skin conditions. So this area right here, it's a little swollen, that's all, but it should hide really well. It's gonna shrink into 3/4 of the size it is now, okay?
Seeing myself for the first time, I'm so excited. It's humbling. It's motivation, it's gratitude, it's all the above.
The first one without that bump on your forehead. That's good, I'll save that.
It makes me feel really good that I no longer will have to Photoshop any of my pictures, especially my unicorn. It was the longest one to take care of, and it's gone.
So just have you close your eyes just because I don't want anything to fall into yours. This is like hot little pieces, almost they look like prosciutto.
Prosciutto.
Pancetta. Some of the butter that's in there. Right now I'm doing really what we call debulking, more like we're just trying to take off the bulk of it.
Right.
And then we'll do some fine tuning here. When we're doing the loop cautery, we're taking some of the weight of this Rhinophyma, this extra tissue of his nose off, but also it's almost like it's frying the skin. It's causing it to shrink a little bit. It's kind of like when you put a slice of bacon on the pan and it shrivels up. It's gonna cause the skin to tighten up and it's gonna open up his nose. Just sometimes wants to ooze a little, so I try to stop that oozing. Trying to get this anterior projection right, but I don't want it to start oozing all over you. My main concern here is I need to keep an eye out for blood vessels because if I get a lot of blood vessels that are slowly oozing, it can make it a mess. And I really can't see what's going on as well. Just trying to stop it from oozing. We don't want that. I think I need to stop. I feel like I'm just dripping right into his nose here. I'm having a lot of issues with just oozing in general. So I have to stop for a minute and really get some of the bleeding under control so I can really proceed and see what I'm doing. Trying to get that anterior projection just right. I still think it's too much and I've got to take it down a little bit. I have to wrestle with the fact that I know it's swollen.
I don't know what a car feels like when it goes in the mechanic.
Oh. There's swelling from just me doing this procedure and just his skin reacting to it, and also because I put a lot of anesthesia into the area. And this swelling really can distort the skin and make it more difficult for me to ascertain how much I've removed and how much more I need to remove. Get very focused at the end because I can see it now, and I'm just trying to do the last little bit, and then sometimes it's hard for me to stop. That's the problem. Wait, oh, sorry, I got it. Sorry, look, this is your skin. This is not my skin. I'm sorry. I'm sorry. Close that mouth.
Salty.
Is it salty?
Then he can't breathe if he closes his mouth.
Oh, yeah, you're right.
He's got cotton balls in his nose.
Sorry about that.
At least it's your own skin.
One of the weirdest moments is when I ate one of the pieces of extra skin. Man, really bizarre.
Yeah, I think I need to stop. Done. It really is looking good. I did warn Jim that the skin particles would look like pancetta, but I didn't expect him to actually accidentally eat one. He was really a good sport about that, though. I think I've done a pretty good job at addressing the projection of his nose. There's a lot of swelling right now, which is to be expected, but it's gonna look great. The most important thing is that he can breathe a lot better now, and that definitely makes this all worth it. Remember, it's swollen.
Oh my God.
And now it's swollen. Looks crazy.
Ugh.
It looks crazy. Still looks crazy, but you see it. You see the potential.
Oh, absolutely. It already feels better, to tell you the truth. As I'm looking in the mirror, it's fantastic. I can already see the change, and I can feel the change, more importantly. All of a sudden, I can breathe so much better on that side. Who knows? I can be a runner now.
It's stuck.
Okay.
That's not good. I'm here with Roger, who has this really big growth on his shoulder. I think it could be a lipoma. I've already kind of pushed around on it, but I don't know whether it is stuck to muscle or not, and that might make me have to throw in the towel. I don't see a muscle here. I mean, it's close to it. I feel better about this now. I think I can sneak him out.
Sweet.
Come on, little friend. I know you want to come out.
You don't want to let go?
It's like it's caught in this little net right here. Do you fish? You know when you have like a knot in your fishing line and you're trying to figure out which direction?
Yeah.
Because all tangled, that's what we're trying to do. Because if you pull too tight, then you're done. You just have to like
go
release
back
that
the other
whole
way.
line. Yeah.
Yeah.
You okay?
Actually, I was thinking, I wish I'd gone to the bathroom before I did
Oh. Right now is like a very hard time for me to get you up and go to the bathroom.
this. Yeah. I understand.
It's getting slippery too. It's a little slippery sucker. All right, it's coming out. Guess what? We took it out. You gotta pee?
Yeah.
DEFCON 3, DEFCON. Can they dump out a drink like out there? Can we get something, guys?
I gotta
I'm
go.
serious. I get it. He has to go to the bathroom, but this is probably the worst time for him to really need to pee. So I really need to bring the restroom to him. Good, thank you. Gonna cover you, keep you covered. I'm gonna do, you know in Japan, when you go pee and you don't want people to hear you, they play music. I'm looking away, don't worry. Happy birthday to you. Happy birthday, dear lipoma. Happy birthday to you and many more.
This is close to being the weirdest thing ever.
La 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 la.
The worst thing would have been if I'd missed the bottle and went all over the floor.
No,
but
that would be terrible.
Okay.
You can grab it with that, yes.
There you go.
There you go.
Look
There
at
you
that. Oh, I feel so much
yes.
better. Mercy.
I tell you, some of the best peas people have are around me. Crisis over. They don't teach you this in medical school. I mean, you had to go and we had to figure something out. Now I can finally stitch up a much more relaxed Roger, and I can't wait to show him the results. So take a look here, okay?
Ooh, doggy. Love it. Looking at my shoulder, I just can't believe what a difference it is and how nice it looks now that it's not there.
You wanna lift that off?
Yeah. Mother. Oh. I cannot believe that that thing came out of me. It looks like a heart of someone who ate too much greasy food and they died of a heart attack.
Okay, so let's see how many of these we can do. All right, I'm ready. I'm gonna put a little baby pinch here, okay? Just a baby pinch, pinch. I know that these neurofibromas are under the skin as well, so I purposely want to take a little bit of a deeper shave. So that's why this time I'm gonna pull up before I shave, because if I pull up, I'm kind of pulling the tissue away from the skin, and that will naturally give a deeper shave. Okay, so you shouldn't feel anything other than my touching you, okay?
Yep, I'm
Make
fine.
sure she's not touching metal, okay. To check to make sure you're okay first.
Yep,
You look great.
I'm okay.
Okay. The nice thing about this is that it cauterizes the tissue at the same time so that it doesn't want to ooze so much. I think this is faster, right, than if I were to do shave, because it would ooze a lot and I have to go back. It might be. So far, I'm really pleased at how well the loop cautery is doing. It is allowing me to remove these completely, but also helping to control any bleeding. So really the question is, how much can Susan tolerate? Okay, so this one, this is a little mitten. So I try not to pull up too much on this, because if you do, while I remove it, it could actually take out too much, or like if you lift it up too high.
Okay.
Here's your little mitten.
Oh, wow, that looks bigger too then.
All right, let's see how many we can do around your face. I know those bug you the most. I was able to remove the most bothersome and painful neurofibromas that Susan had on her back. As long as she's comfortable, I'm gonna do as many as I can on her face. Chin. Close your eyes, I'm gonna go one right between your eyes. That's okay with you.
What that's bothering me now is my leg won't stop shaking.
What is it? Do you want to
it's probably the adrenaline.
Numbing? Oh, okay.
Adrenaline.
Sometimes that does happen.
Oh, okay.
I didn't put a ton in, but
It just kept on shaking, so I just think it's the adrenaline the whole time.
Yes, it is. Well, this has adrenaline in it.
Yeah.
Epinephrine is a natural hormone in our body. It is adrenaline. It's like what's in EpiPen to get your heart moving again. And in people who are more sensitive, it can actually make them feel really jittery. So I've already finished all of the numbing. I can't remove the epinephrine. So at this point, I just want to try to take these off effectively and efficiently and make sure she's not shaking when I come at her with this loop cautery tool. I'm doing a lot of delicate work around her face, so I really need to make sure she sits still and she doesn't have as many jitters. You want to turn that off for just a moment? I'm gonna just try to snip these off here and then I'll buzz them. The buzzers, they're working, okay? Just keep your eyes closed. Turn your head a little this way, good.
You're doing really good.
And for the last one, let's get rid of this one on your head that bothers you when you brush your hair. Okay?
No, it feels a lot better now. All right.
How are you feeling?
I feel good.
I like that. I like to hear that. Okay, hold on. Let me sit you up for a minute. Let me take this stuff off of here. Susan did great. I think that with her little reaction that we had to the numbing, we should quit here. I mean, we got rid of all the ones that really bother her, and that was the point of it. And I think this will make her really happy. So you can look beyond there.
Oh my.
You're not gonna have those bumpies so much anymore.
No, I'm not. Wow.
Flat there?
Yes.
Seeing myself in the mirror for the first time after the procedures, I feel amazed at how great I looked. I realize that I do have some neurofibromas left on my face, but they are minimal. I feel better looking because I'm no longer looking in the mirror at the bumps. I'm looking at myself back when I was younger. I feel like I'm young again.
Okay, first one. You can see it. Pilar cyst. I'm here with Angela, who has 4 bumps on her head. I think that they're pilar cysts, but they're different sizes and different shapes. So, I mean, maybe they're not. I'm gonna start with the smallest one and take it from there. It will make things a lot more complicated if there's one pilar cyst and the other things are other things. You okay? I'm just pulling on you.
Yeah, that's fine.
Okay, good. Yeah, see, this is like a little baby one, actually. It's pilar cyst. Okay, one down. Let's do the one on the side of your head next. Sometimes some people's just pop out, but yours have been a little more stubborn. You okay?
Yeah, I'm good.
She's sitting back now. Grosses you out?
She would always be like, look, touch it. And I'm like, no, I'm okay.
You don't want to necessarily touch it.
I just like to observe.
Okay, got it. Okay, it's another pilar cyst. This one was a little mushy. Okay, I'm moving right along. There's 2 down and 2 to go. Because the 2 first growths were pilar cysts, it's a pretty good chance that the other 2 are the same. But this one on the top has been really smushed down. It's kind of flattened, so it could be a little bit of a challenge. This one, I think it deflated just a few months ago, so I think it's halfway liquefied and might be kind of gone too. More orange juice up here. So now I'm just trying to get all the sac wall, but it's in pieces right now. This is more complicated in the fact that it's stuck to you. It's another pilar cyst, though. Okay. This cyst was certainly something that was a little more complicated. I think I did manage to scrape all the contents of this cyst out, but all of this was really just the preamble to the big one. Okay. Make sure nothing hurts either.
Okay.
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 You can see the little egg here underneath here. And I'm trying to see if I can take out whole. Back up a little bit. I'm more nervous that I don't want this to pop on me. That's what I want to.
I know.
Should I squeeze it? What do you think? You could try it. Okay, so hold on. I'm going to poke one little. Don't spray us. Might be that quiet. Yeah, it's going to come out. It's like egg yolk. Oh, yeah. Sorry. I have noticed that Angela's cysts are pretty liquefied, so I'm gonna try to see if I can aspirate some of the fluid first, deflate it a little bit to make it more manageable and less messy.
You okay?
We're okay, yes. Oh, we're okay.
I think she was asking me.
Oh, sorry. It looks like orange juice.
Oh, no way. It's a mimosa.
It's a mimosa. I'm just trying to pull it out now. Release it smaller. Oh, I could see it was probably liquefied, so I had to pull out some of the fluid. The big one is gone.
I feel like I can breathe.
Oh, you couldn't breathe before? Was it stressful?
A little bit.
That was a very orange, juicy cyst. I'm very happy that I aspirated some of the contents because that thing was under pressure. And so I'm really happy that we kept the area nice and clean so that I could really ensure that I removed this cyst and its sac wall in its entirety. Can you see over here?
Oh my God.
See what came out? It looks like orange
God.
juice. See, this was filled with orange juice. Look,
The
watch.
orange juice is in it.
Inside here.
Oh, my Lord.
Seeing what came out of my mom's head, it's fascinating and kind of gross.
You did so great. Let me show you what you look like here. There's gonna be no more unicorn though.
Yeah.
Okay? Oh, you did so good. I'm so proud of you.
I'm proud of you. I'm so happy, and I can't describe it in my words. Today is my very, very best day. I'm so happy.
I'm just gonna put a little baby numbing here, okay? Baby numbing. I know Mike would love all his lipomas to be removed. Mike's a big guy, so he's probably used to getting what he wants, but he just met his 5-foot-tall match. I can only do what's safe, and so let's just take one area at a time and see how it goes. So you shouldn't feel anything other than us touching you, okay?
Okay. If I do, I'll say something.
Oh, I'm sure you will.
I guess.
Replica of this.
My dad gave me a nickname, Bab, because I was always babbling.
Oh, you were? That's cute.
Did you already take one out?
I did.
Really?
Mm-hmm.
They're not giving no problems?
Well, I only did one.
Oh, what you been doing down there, Dr. Lee?
All right, I'm done. Forget it. I'm out of here.
You gotta be nice to Dr. Lee. Remember, she had the knife, you don't.
Still working on that same one?
Hey, you know what? I think he should be knocked out the next time.
Did it go? Yeah, I've been known to talk too much.
Look at his sexy leg coming out, though. He's got a lot of lipomas on his legs, and I don't want to leave him with as many scars as he has lipomas there. So I'm trying to sort of hunt for some of the lipomas when they're close together. I mean, the difficulty about that is that I have to push and pull and dig a little bit for these lipomas.
Oh, yeah. Ooh.
All right, there we go.
It came out?
I had it.
Oh, my Lord.
All right, we're good on that side. One leg is done. Now I just need to stitch up all these incisions I made and move on to the next.
This right side is going to be the challenge.
Oh, great.
Yeah, maybe you should have did this one first. Told you the side was going to be the problem.
And he thought I was gonna do his arms and his legs and his back and his tummy.
You come down here to challenge you, Dr. Lee.
Looks like a brain.
He's stubborn.
Get out of here.
Don't look.
I looked at it. I didn't mean to.
And this is the last one. Done. I removed a good amount of really big lipomas from both of Mike's legs. I need to stitch him up now, and I think he's gonna be really happy with the results.
Well,
look at those sexy legs coming back.
Yeah, coming back.
Let me stitch
Wow.
you back up here.
Okay, well, thank you. What about the side cluster? And I got the ones around the ribs and maybe arms.
Oh my God. You are persistent. Because there's a lot of issues with your stomach, and I don't want to. I don't even want to go too close to that. You know what I mean? That there's just you need to address that first. But you know what? You're charming. I like you. I don't know why. Against my better judgment.
Like you too, Dr. Lee. Thank you.
So we're gonna do arms, okay?
Okay, thank you. Appreciate it.
I admire Mike's persistence, so I'm willing to try to take off more for him because he's just such a sweetheart. Okay, here we go again. Just, they're spitting at us. They are spitting at us, like, ooh.
Oh, that was a little pop.
Yeah, it was a little hop. That looks pretty good. I'm gonna move on to the left arm, and the lipomas are spaced out a little bit different. They're a little farther apart, and hopefully I can get through this one. If you can hold like that just for a little bit here, let's try that, okay? The thing that behaves more than anything else is his lipomas. Oh, yeah. This is the last one. You wanna watch this last one popped up?
Yeah, why not? Well, yeah.
Why not?
Oh my God.
There's your friend.
Oh, God. Ooh.
There's your friend.
Pop goes the
Looks
lipoma.
like a little bear. As much as Mike pushed and pushed, he was an absolute pleasure, a delight. And I do hope that he's happy with the results because I am not doing another lipoma today. What is 9 plus 11 is 20, plus another 11 is 31, plus another 6 is 37. Yeah, so look at all these things you left with us here.
Dr. Lee removed a total of 37 lipomas. I was wanting to be the record breaker, but I'll take it, and I'm happy, and I'm grateful for it.
But look at all the stuff that Dr. Lee have removed. It's
Yeah, that
just
was
amazing.
a lot of work. I gotta take a nap after this. Get that hernia taken care of, okay? Because once you do that, then you can address the ones on your torso.
Okay.
See how that one's like encapsulated? It's got its own, like, yeah, it's like a little patty.
Some of my lipomas, you know, they look like chicken breasts. Some of them even look like little gummy bears. Probably not a gummy bear I should be eating. And so it just feels so weird that this was in my arm and in my body. And I'm just thankful that it's out of my body now.
The first thing I'm gonna do is put some numbing there, making sure you're nice and comfortable, of course. So first I'm gonna use the loop cautery to melt some of this seborrheic keratosis off as flush to the skin as I can. It's a really big SK, so it's going to be difficult to manage, but I'm trying to really kind of debulk a lot of this growth. I don't want to make an indentation there because that's knowing that I could be destroying a lot of the hair follicles and she won't have hair growth there. Just gonna just a little bit here first. That's a vacuum. Sometimes it gets a little smoky. Okay. You okay, right?
Yeah.
Okay.
Yeah.
When I melt seborrheic keratosis, it really kind of gets sticky and sticks to the loop. And it looks kind of like roast beef, but it definitely doesn't smell like roast beef. It's got a bunch of hair gel and stuff stuck in the crack. I've actually never done it quite this way.
Yeah.
I hope that didn't worry you, but I figured because it's so big here, it would be like using a spoon to dig a pool or something. I was dreaming that I could maybe take it off in one piece. No way. That can't happen. I gotta take it off in pieces. Almost all the top of it off. Okay. You still have to fine tune it though. Okay, let me just see if I can get some of this off of this without it being too much of a problem. After I've used the loop cautery to really debulk a lot of this lesion, I'm gonna use this device that's called a curette. It's essentially like a spoon with a hole in it that has some sharp edges, so I can really kind of scrape and smooth out this area. This is actually how we commonly do some bigger ones on the body with this kind of tool that's like a spoon, but it can kind of help us to fine tune it. So I'm just trying to use a certain level of pressure to scratch it that I feel like is pressure enough that real skin won't come off, but that seborrheic keratosis will come off.
Yeah.
I guess it's like using a coin to scratch off the numbers on your lottery ticket. You know, if you don't put a certain amount of pressure, you're not gonna be able to see your numbers, but if you put too much pressure, you could really scratch off the numbers itself and you won't even know if you won. And maybe I can help find somebody that, like, if you feel like it's starting to come back, we could like have them freeze a little of it or something, because it's easier to try to prevent it from growing back if you see a little something starting.
Yeah.
It's gonna look really good. We see that the seborrheic keratosis is gone there, and I know that I didn't go deep enough to destroy her hair follicles. But seborrheic keratosis cells can dive down within your hair follicles, and it is more likely to come back in those areas. It is possible that she might need some little touch-up procedures here. First, let me show you, I guess, some of the fragments.
Yeah, let me see that ugly thing.
It all came off in pieces.
Ugh. Looks like a bug.
Like a mohawk. Oh, yeah, like a caterpillar.
Yeah. Ugh.
See the hairs? Hair follicle? Wow. All right. Now we can go out on the town. Okay?
Yes. I've been dealing with this thing since 1998. It's been a constant cause of anxiety for me, and in 1 hour, it's gone.
Have a safe trip back, and I'll try to connect you somebody up there.
Thank you so much.
You're so welcome. That's a great hug.
It's really gonna enable me to start dating again. It's going to change how I interact with people, my confidence level, just so many things.
We're gonna get ready, because it might want to ooze on us. I've got Ramiro here, who has a large cyst on his jaw. It's been removed before from the inside of the mouth, but it came back. So this time we're gonna try from the skin side to remove it. So that does mean that I might get a little wet here. We're all prepared in case this wants to leak on us. The cyst is intact. It's just that we're trying to tease it away now. You have a big cyst here. There's like a big balloon under there. And we're trying to delicately...
Es como un globo de agua.
Oh, sí.
Ajá.
How am I gonna take it out like that? We're going to go ahead and squeeze some of it into here because it's too big for me. So I have like a little basin under here. I always like to get it out whole. But when a cyst is pretty deep, I can't really see what's going on under there. So there's a point where I have to decide, okay, I think I'm gonna pop this, clean up that little mess that is made from popping, and now I'll have just the cyst sac wall to deal with, and I can see around it really well. Ready? Do you like to eat oatmeal? How do you say it? Oatmealito?
Si le gusta comer avena.
Casi no.
Porque eso es lo que le está saliendo ahorita.
Sí.
Es como un globo de agua que está lleno de avena. Lo rompió, sí. Decidió mejor romperlo para que saliera el contenido adentro.
All right. I mean, aren't Pop's cool? They're never the same. He's got a pretty good one here. The challenge will be removing this cyst sac wall, especially because I know that this cyst was attempted to be removed from the inside, so the bottom part, maybe the part that has the most scarring, might be the most difficult to remove. What happened is last time when they removed it, they likely didn't remove this entire sac, probably because it was on the inside and it's hard to see. You okay, right? No dolor?
No dolor, nada.
Got everything Everything looks good. We're almost got it. It's getting close. I think we got the whole thing under there. I think it was the best decision for me to really squeeze out the contents first because I know that this was attempted from the inside of the mouth before and they weren't really successful. So being able to see really well underneath it gave me a lot of confidence that it's not gonna come back this time. So take a look here, okay?
A new face.
Good.
Yeah, Dr. Lee. Thank you.
Oh, you're
Thank
so
you.
welcome.
Pues que se acabó la bolita que traía. La primera fue de no mirar más esa pelotita y que ahora sí como si tuviera una nueva cara y me ganó la emoción, simplemente.
I know it's a little annoying in the beginning when I first start numbing it.
All right.
It gets a little tight. In order to numb up this part of Eric's butt, I'm gonna use a Tumescent technique. And this is when I really bathe the area in fluid that is going to anesthetize it, but it will make this area look even bigger. It's gonna make it look like the Haleakala volcano ready to pop. All right, let's see what we got here. Yeah, it's your little lipoma, and he's talking to me a little bit. Buzzing noise you're gonna hear, you shouldn't feel anything. It's a cautery that stops the little baby blood vessels from oozing, just so we can see things better. As I go, I'm gonna be really cognizant of any bleeding and try to really target any blood vessels that I see oozing. So I'm always very careful, and in the beginning, I move pretty slow. You saw that it's kind of bumpy. There's like a lot of little areas that are tethering it in place, so I'm just trying to break up those bands. Eric's lipoma is pretty attached to him. It doesn't want to leave, so this is gonna be quite a challenge. I feel where he's like stuck in these little tendrils here. He's like tethered in there. There's a lot of fibrous bands that are keeping that lipoma intact, but I really need to get out every little piece of this lipoma. So patience is key here. Let's see if we can't squeeze some of it out. You okay?
Yeah.
Just pulling on you maybe, but nothing should be sharp. This is going to take a long time, but I gotta hang loose. I gotta shaka and just chill out and get this lipoma all out. All right, I'm gonna get ready to squeeze. It's just stuck. Just gotta take you out in pieces, but that's okay. We can do that. Sometimes it takes a little more work. I was really hoping that this would be a nice, beautiful Hawaiian island, perfect lipoma, but it really is ending up being kind of a mess. And I'm thinking I'm gonna have to take this out in pieces, so I really have to switch into meticulous mode. Okay, sorry. Thank you for telling me. Sorry, we're pulling on you a little bit. It's because it's like kind of tugging on your muscle there, okay? This is getting out of there now. It is coming. Well, I didn't think this was going to be this involved in terms of the time here. Yeah. But that's what they do to us sometimes. All right, I am very pleased right now. He is saying aloha to that lipoma, but now I am presented with the next challenge. What are we gonna do with this little pouch you got here? There's really a delicate balance as to how much skin to save and how much skin to remove here. And it's because it's one of the more stretchable areas of the body. If I remove too much skin, the scar will stretch, it will look terrible. He won't even be able to bend down and touch his toes. The solution is leaving a little extra skin so he's got some give, he's got some movement there. There's a lot of movement in our tush, obviously. Like when you bend down and squat onto the ground, like you stretch it. So I'm gonna try to arrange the scar so there's the least tension on it, which means it's kind of vertical, like along your crack, you know? Okay, so that when you stretch, it's not gonna pull on it. Okay, let's see. Look at that. Back to a flat booty. Aloha lipoma, aloha lipoma, aloha lipoma. Look at that tush. Now you're back to just a crack in your back. Okay, let me take a picture of it. Okay. Here it is from the side. It's easier to see. Like, Kyle, look at that.
Wow, crazy, yeah.
Looking at my butt for the first time after the surgery, I feel relieved. Before, when I had the big bump on my butt, I felt like a monster. Now my self-esteem is gonna go up. I'm looking forward to dating, and my parents definitely want grandkids. Now that my lump is removed, it could happen. I've been waiting for this day for 5 years now, and it's great. I feel great. I'm happy this is over.
Make sure I'm not hurting you. Try to see if we can get it all. Oh, sorry, pinchy. I'm here with a very nervous but very sweet guy, Michael, who has this giant cyst on his head, and I just don't want a big splash to be part of its final performance.
Okay, it's just I can feel it. I just
Yes,
think
no, I'm glad you're telling me. This bump has really stretched the skin there, and I know that I'm gonna have to take a lot of extra skin there anyway, so why not make a bigger incision, because I know I have to remove that anyway, and try to get this out whole. It's not so easy, this thing. Because it's so round, I can't see all the way around it, so I have to like change position of you. Can I squeeze it out of that wedge? I thought maybe I could. Sorry, I'm almost done. I almost got the whole thing. I gotta get underneath it.
Did you get it all?
Almost. I have to get the under part of it that's stuck to you. It's right at my eye level. I do like them when we get them out solid. You got it off. Don't you feel lighter?
Yes, I do.
Okay, so now I'm gonna close it so that...
There's not a hole there?
There's a hole here, yeah.
Is there a dent there where I hit my head?
I didn't notice an indentation. No, I didn't. We did it. We finally kicked Michael's cyst off the stage, but now the hard task really begins. This is me trying to close the area nicely, and I want to reorient the skin. I need to keep the rotation of the hair the same, but certainly also remove any kind of bumps that are noticeable.
Does it look good?
I mean, it's gonna look bumpy to you right now, but it's gonna look good. Are you excited?
Yes.
Now, Michael might be down a comedy prop, but he should be smiling and laughing a lot more now that his cyst is retired from the spotlight. Just bumpy.
Oh, wow, it's totally not bumpy. That is awesome. Wow. Wow, I don't even see a dent. I don't see a bump. I don't see nothing, you know, just smooth head. That's cool.
Here's your friend.
What the hell?
He's got his tongue sticking out.
And his little nose. Oh my God, that is crazier than you don't know what. I totally didn't expect it to look like that.
Do you think there's gonna be some gold coins?
Wow, that's crazy. Yeah, that's enough.
Look what you were holding in your head.
That is so wild.
You know, that hat is retired, right?
Yes, it's done.
Cyst is done.
Without the bump, it's gonna be a little different. We can still be funny, I guess. I'll try.
The first thing I'm gonna do is really pay very close attention to the concentration of numbing that I'm giving. Robert is on blood thinners due to his heart condition, and so because he has a higher propensity to bleed easily, I have to really have a more dilute concentration of lidocaine and epinephrine in the solution. The epinephrine is gonna help to temporarily constrict some of the local blood vessels, but too much of that can really be toxic to the heart. So there's a really delicate balance here. I think what I'm gonna do is, because this one's numb, I'm gonna get set up with the cautery.
No problem.
If that one does okay, I'm gonna do the cluster of them. It's certainly safe for me to start with a few of them. I mean, if they start shooting blood, then I'm just going to cauterize the heck out of it, and we'll see how that goes, and I'll know not to proceed. Okay, so I've numbed this one. You shouldn't feel anything. You let me know if anything hurts, okay? I decided to use my loop cautery tool. It really kind of burns the area but seals it closed. I really have to determine the best technique, and it sometimes takes a few tries. How deep are these going to go? Are they gonna just kind of easily shell out, or do I have to really dig for them? You can see how that cuts and cauterizes at the same time.
Yeah. Wow.
So take a look at that. That looks all right. It'll heal. Well, it's not looking like it's oozing. The first one kind of went even better than I expected. So I'm just want to take these off and take a look at what the whole area looks like and then watch it for like a couple minutes. So the first removal was uneventful, not a lot of bleeding. I got the area pretty flat. So I'm gonna move and extend to a larger patch, and let's see how that goes. Can you turn that off for just a moment? Sure.
Wow.
So, good thing is I don't see it bleeding, so that's good. The question is, imagine if you have the little orange spots like that. Do you think that that's better than what? I didn't even get to answering.
Tell you that right
okay.
away.
Yeah, I just want to make sure you know that.
This is way better than any of this.
All right, and let's just start going up the arm here. Robert is not bleeding, and that is great, but I've never removed this many xanthomas at any sitting. I need to do this very efficiently because I want to remove as many of these as I can, but I don't want to leave him looking worse. Turn your arm out a little bit here. I'm gonna do this bigger one that we numbed. Okay.
Yes, those ones.
Yeah, you don't like these. I'm gonna stretch it a little because
Good.
How many years have you had that and just watching them kind of come off right in front of your eyes? That must be pretty trippy.
It's a crazy feeling.
Is it?
Ooh, look at that one.
Did it hurt?
No.
Okay, your arms are looking a little different, aren't they? Starting to look a little different. So far, so good. Okay, I feel like I'm getting a good handle on this. So I'm gonna just take this crop off here. It's really like a crop of them. Now I'm gonna move on to the underside of his forearm. I just have to continue with caution with the amount of numbing that I use because this is a really dense area filled with xanthomas, and it's also really sensitive there. All right, let's see. Stop for a second. Looks pretty darn good.
From what it was to what it is now, that is a big difference.
Yes, it is.
I look at the pile of bumps that Dr. Lee has removed. I think I see about 100, maybe a little more. I think to myself, I'm shedding myself of all this negative energy that I've held back for so long.
That is crazy.
It's just a wave of relief coming over me that this is actually happening. This actually happened. I feel amazing. I feel like a new person right now because just seeing where Dr. Lee took them off, I couldn't believe that they were gone already. Dr. Lee surprised me by bringing me out 3 more times to finish the procedures on the rest of my arms. That's a large one. Each treatment took a couple hours, and she removed as many xanthomas as she could.
Moving right along.
Dr. Lee made me feel so relaxed that I didn't have any anxiety.
All right, looks pretty good right now. Areas that you let heal open, or what we call secondarily, will take longer, but time should continue to heal them. I think I'm done.
It's been 8 weeks since I've seen Dr. Lee for my last procedure. My arms look incredible. They're smooth, and I feel like a brand new man. Dr. Lee removed hundreds of bumps off my arms. I don't bleed when I bump into stuff. There's no more pain. It's a great feeling.
Ready to get this thing off?
Yes, ma'am.
Did numb you, but if you feel anything, you let me know, okay? I'm really aware that Alexis experienced a lot of pain during her last procedure when they tried to really aspirate this cyst. So I have to be extra careful and really make sure she feels like she's in control. It was pierced before. I'm gonna just try to remove that little scar line there, that little puncture that they had. Let me know if anything's ever uncomfortable.
You know I haven't told anyone in my family that I'm here.
You haven't?
Nope. I'm gonna have a party at my house. I'm going to say I have a secret that I've been keeping and I want to tell everybody what it is.
Cysts can come in various shades. I think it has to do with the melanin in our skin. I think that the darker complected you are, the more range and shades your cyst contents can have. You should have a potluck and bring in things that they thought your cyst reminded them of or something. Meatballs or something, I don't know.
Yeah.
Like little appetizers.
Maybe some dip.
Yeah, like a dip that say this could be what the contents look like.
I have this chicken queso dip that I do.
Oh, okay. Well, I'm gonna show you what the contents look like, then you can see if you can make something
See
out
if I
of
can,
it.
yeah, if I can get close to it.
Yes. So just gonna feel me pushing around here. I'm just trying to tease the sac wall from your skin. It's always kind of fun to make food analogies during surgery, but boy, Alexis is gonna be pretty surprised when I show her this, because it doesn't look like queso dip. But it did come out nice and smooth, so it's got that going for it. Now my most important job is to carefully remove the cyst sac wall from the surrounding connective tissue. I'm trying to get this sac in one piece, because if I take it out in one piece, then I'm pretty sure I got it all. You okay, right?
Yes,
Can you please tell me? Almost have it, and it's coming out like a little swim cap under there. Got it off? You did awesome. I checked, and it looks like there's nothing left, so now I can sew up Alexa's cheek really nicely, and I can't wait to show her the results. So, you said that you were gonna make something for this pimple potluck that looks like the cyst contents.
Let me see what I can
I don't know what you're gonna make with that.
Oh my God.
You can see why it was that color, huh? It's almost like tar. So that's all just dead skin. Look at that. Skin cells that are smushed in there. Here's the sac. See, we got to tease it. Yeah, that was what was. Oh my God. That's good, because we definitely got the sac this time.
I'm just really excited. Now that the sac is gone, it's not gonna grow back.
Now I'm gonna show you your cheek here.
Oh my God.
Here's your cheek pack. Don't cry. Oh, I hope those are tears of joy.
I feel just a complete overall sense of relief. Having the bump changed who I was. And to have Dr. Lee remove it, it just gives me everything that I wanted.
Shouldn't feel anything other than us touching you. I'm sad to see these go. Can't tell you because they felt so nice.
Bye-bye, baby.
Good. That's gonna be okay. You okay over there?
I'm sorry. I'm just always emotional. Watching the procedure, it just made me so emotional that finally there was an answer, and Dr. Lee just made me feel so at ease.
How did you guys meet?
Roller skating.
Roller skating!
He was trying to help me learn how to skate.
Yeah, I kept teaching her. She got better at it, and she had more fun.
Oh, that's nice. I think I've been pretty meticulous about this. That looks good.
Oh my gosh, that's amazing.
I'll also get the results just to confirm with you that I know it's nothing to worry about, but don't lose any sleep over it.
Okay.
Although I'm sad that I'm not gonna be able to stroke Stuart's back anymore, I think that Stuart's gonna heal well and really only have some light scarring, but this is really gonna make Donna happy. Oh, we got it all, I think.
So much better. I was amazed. My back is smooth. I'm very happy. I'm just ecstatic from the high I feel.
And that was exciting and fun.
Yes, it
Actually,
was.
yes.
Now, if people see my back, it doesn't matter.
And now you're not gonna have those. I'm a little sad about it. That's okay.
Yes, well.
I'm just so happy I can, well, I can't touch it now, but it's gonna be nice.
I'll have to fight her from putting her hands on me.
All right, we think this is a lipoma. Make sure nothing ever hurts. I'm just gonna take a little peek at it. Ooh. Oh, I'm sorry, that pinches. I'm sorry. I'm here with Elaine, who has this big growth on her left side, and I do see veins there in a really threatening position, so I wanna make sure I minimize bleeding, and she does have a lot of sensitivity in the area, so really making sure she's nice and comfortably numb is really important. It's all tucked around it, which is a good sign, which means it might be solid and pop out. Come on. Okay, let's squeeze it, might squirt at us. Ready? All right, that's a pretty one. You're gonna be excited to see this cute friend of yours. We're cutting you off, lipoma. Don't get all excited about oozing on us. That was a very smooth pop, but there are a lot of blood vessels here that I need to cauterize really meticulously so that she does not have a bleed. See, what I'm trying to decide to do is take off part of it first. You can see it's like almost older here. Just hold it. Oh, this is heavy. This lipoma came out initially really pretty, but it's very stuck at the base, and that's why I really had to lop the beautiful top young part off so that I could take a better look at what's going on down underneath. We got most of him off.
It's giving you a tough time, huh?
It is diving down towards your abdomen. Maybe is it split in your abdominal wall? Is it like occupied with your muscles? Because I got the whole top of it. I think part of it might dive down underneath, but I don't think I can pursue that because I think it's going down straight towards your insides, and I don't go that way. It doesn't mean that something's going to come back. I think it looks great right now, and I just got to take off this extra skin. Like I said, you don't want a pocket here.
Okay.
A pretty good piece of skin here. It's almost like you're having a little side plasty, an abdominal plasty. Give that to you. All right, now I'm gonna get ready to put in stitches, and then we're done.
Looks so good.
It's possible that there's a little piece of lipoma that escaped my grips and is tucked in behind her tummy muscles and hiding from us. But never fear, if this thing shows its face again, I'll be right there just ready to snatch it away from her. Time to stitch Elaine up and send her home with one less boob. All right, you ready for that? Okay.
Okay.
Because obviously you're sitting down, so everything's bunched up and it's swollen right now. So all this will settle down. You won't get that chafing anymore,
That's right? Oh, yes.
Okay. But right here, it really dived down, like I think beyond your abdominal muscles. That's why I was pulling on you.
This is the moment that I have been waiting for, to finally put my arm down and it's not sitting up. I feel amazing, I feel refreshed, and I just feel brand new.
That what was inside of me, oh my God.
This is the part that was stuck down deep. I had to take it out in pieces. Gave you a little tuck, right?
Look at all of that fat. Wow.
I am going to be so excited and so confident to hit the red carpet, work events, work more in TV and film. I'm just ready to show off the new me.
I'm going to address this lesion conservatively in the beginning. I'm concerned because of the redness there. Is that because it's a little inflamed, or could this even in fact be a vascular growth? I think Jessica is so eager to remove this that she's not really grasping how dangerous this procedure really is. Okay, just gonna see what we might wanna ooze here a little, so we're prepared for that. Does look like a cyst, the regular kind of cyst that we deal with.
Thank God.
Thank goodness this is just an epidermoid cyst, but that does not take away from the fact that she could still lose some movement in the eye here. So I have to still proceed very carefully. What do you think it looks like?
I think it looks like a marshmallow.
A marshmallow? This is one crazy marshmallow.
Ooh.
Good. We're squeezing some of it out. It's definitely a cyst.
Oh my God, I can already feel a difference.
Really?
Yeah.
That's good. You can feel the tension has gone away a little bit?
Yes.
Just trying to squeeze as much of it out as I can. It's not like it's... I'm just squeezing. Oh. Don't you get too upset on me. I'm too close to your eye. I don't want to have to deal with tearing or anything like that.
Yes, ma'am.
Now, I would like you to open your eye for a moment. You don't
It's
see
not
it
there.
anymore. Yeah. But you can still see, right?
Yeah.
Good.
Yep.
Good. Your eyes are so beautiful and blue. We're going to see more of them now. So close your eye again, and I'm going to try to tease the sac out here. I'm going to put a little more numbing around it just so that it's more comfortable. The good news is that Jessica still has full control of her eye muscles, which is fantastic. The not so good news is that I'm not done yet. I still have to remove the rest of this sac entirely, and that takes a lot of precision and a lot of care and a lot of time. I don't want to affect any important nerves under there, but deflating it has really made it easier for me to see what's going on underneath. You're doing great. You're a tough cookie, I can tell, so. Trying to stay as far away from your eye as possible. Just trying to really delicately remove this from the upper edge, closer to your eye. Okay, that looks pretty good. But I do believe that 100% of the cyst is gone. Now, I'm gonna put some stitches right there, okay?
Yes, ma'am.
Jessica did an incredible job. She stayed really still, she stayed really calm, and now I'm designing this scar to be hidden in a natural transition area between her nose skin and her cheek skin. That's gonna help to pull the scar away from her eye, but also make it less perceptible. I'm excited to show you. Okay, Ready to take a look?
Oh my God. It's beautiful.
The profile.
It's great.
Yeah, you see the potential.
Yeah, that's crazy. Thank you so much. Seeing my face in the reflection for the first time with no bump makes me feel elated and grateful and shocked. I haven't seen my face flat like that in a long time. I feel like the monster is gone, for sure.
Here's your marshmallow.
Oh, my goodness, that is gross.
Yeah.
With the decisions that I've made throughout life and the lifestyle that I lived, my goals and my aspirations are just to move on and experience life like I should. I feel like Dr. Lee has given me the opportunity to show that I can be better and I can do better. And I'm already feeling the new beginnings. Thank you very much. Keep changing lives.
Oh, thank you.
Yeah.
You're so sweet. Oh. He's in shock a little bit. I'm here with Dwayne, who has bumps around his nose. This is called multiple trichoepitheliomas. Dwayne is sensitive to needles, but I really have to numb up this last bit here, and he's got to let me do that, otherwise I can't proceed.
Okay.
Okay?
Mm-hmm.
You feel like a pincushion? Dwayne was able to push through and let me anesthetize him completely. Now the hard part comes, though. I need to use my loop cautery tool to really re-sculpt this nose and mouth area. So I'm gonna do just a little bit of one here first, just so you know what it's about. You good?
Mm-hmm.
I wanna make this area look as natural as possible and bring his cute nose back. This is a delicate surgery. I'm trying to go deep enough, removing all of the trichoepithelioma, but not so deep that I leave him with dips in his skin. You're comfortable, right?
Mm-hmm. Other than the smell.
Yeah, I know. I'm trying to suction it as much as I can. All right, done on that side.
Good deal.
It's halfway done and it's looking good. Now I need to tackle the other side and make sure that it matches the first side. I need to be really precise. If I do too little, he'll be left with some bumpiness there. If I do too much, it could draw just the same amount of attention as it does now because he'll have a big, noticeable indented scar. It's like Goldilocks. You don't want it too much or too little. You want it to be just right. You got that big piece off. I'm just trimming it down now. So close. Now we're just doing the cleaning up part. Okay. So I'm gonna have you take a look. Right now it looks a little bit bumpy. It'll smooth down. Even tomorrow you're gonna see a difference. What do you think?
Looks good.
I feel amazing. The last time that I had seen my nose smooth was when I was 20 years old. I am confident in myself again, and I'm ready to get back out in the world. Dr. Lee got the job done.
See your little friends there? Or you don't want to feed that to the fish? I bet you catch some fish with this.
No.
Well, they'll bait the hook with these. You got a good-looking nose.
Thank you.
You're welcome. All right, you take care, okay?
Yes, ma'am. My life has been shut down because of this. Now, I don't feel like the beast no more. I feel great. I'm ready to show my girlfriend we can start a new chapter in our lives. It's a great feeling.
Ow.
Oh, sorry.
Yeah, that one hurt.
You could not have a baby.
No, I couldn't.
I'm here with Madison, who is a delightful reptile hunter. He is a little squeamish about the needles, so I have to treat him with a little extra TLC. This always happens to the tough guys. Have you ever seen an iguana hatch?
I have caught freshly newborn babies.
Oh, are they cute?
Oh, they're adorable.
So I'm gonna put stitches right there and we're done with that one.
Wait, what?
Yeah, the big one. Madison's first cyst popped out like a perfect iguana egg, if that's what iguana eggs look like. He handled it pretty well, but I know he's a sensitive guy, so I still need to continue to distract him so that I can get out the rest. Christy, do you want to guess what he does for a living?
I don't have any clues.
Yeah, okay, good.
Do you work outside?
Yes.
Do you have to wear a helmet?
No.
I don't know.
Do you want to know what it is?
Yeah.
So I do invasive reptile removal.
Oh, so
that's-
if they're like stuck in a house or somewhere they're not supposed to be, you come in and take them out?
Yeah.
That's so cool.
All right, we're getting there. I'm glad that my girls are just as intrigued with Madison's job as I am. 2 eggs hatched and 2 to go.
Ow. How long does that numbing stuff last?
Does that really hurt there? Sorry.
It's like a tearing.
Okay. I was expecting these squished down bumps to really create scarred up, difficult bumps to remove, but it was like 3 perfect iguana hatches. I hope the last one behaves. These up here, I think you smushed them down. You know, wearing things on your head like hats.
Well, also I hit my head a lot, so branches and...
Got it. You got very compact pilar cysts here. Oh, sorry, Valerie.
I don't know
It
what...
didn't get you.
No, it fell on my shoe. I just had to tap it off.
Almost have it all. It's coming, but definitely deceivingly a little bit. The heck, though? This one's got like a cluster.
Yeah.
Take it off, put it here. I knew there was gonna be 1 at least smushed in there, but this one actually had 3 of them. They were misbehaving and they really had their direct aim at Val. So in total, there were 6 cysts actually on Madison's head, and I came out clean at least. Do you wanna see what your head looks like? Hold the mirror for you. It's just a little bumpy because there's stitches. They'll flatten down, okay? And now, are you okay? Did I make you cry? What happened? The iguana wrangler is crying.
Nah, big strong man.
They must have really bugged you. Aww.
I'm seeing my smooth head, and it's amazing. It's... Last time I saw my head look anything near it like it does even now was high school. It's awesome.
I just never thought this would happen.
You did great. I'm so proud of you.
I'm looking forward to not being riddled with anxiety every time I leave the house if I forget my hat, or people making fun of me, or can I touch it? It's like a huge weight's been lifted.
So, like I said, I think we shouldn't target this bigger one right here. But I do think we'll get rid of this little bridge you got right here, like this kind of thing, right? There's like a connection.
That's a tunnel there.
Chanel's HS is more extensive on her right armpit, but on both sides she has a lot of scarring and a lot of bridges and adhesions on the surface of the skin. So what I'm gonna do is first tackle a lot of the scarring and really kind of open those up so they don't pull on her arm and restrict her movement. But I'm also gonna tackle the smaller pocket on her left side. Let's see how she tolerates the healing process, and if she does really well from this today and it looks great, let's do the bigger one the next time. So we're gonna turn on that. Wow, this makes it look better already. Looks a lot better. It cleans it up. It makes it more comfortable for you. I removed all the little skin bridges from Chanel's right armpit. So now I'm gonna remove one of the smaller tunnels from Chanel's left armpit. Just make sure nothing hurts again. Okay?
Yeah.
Pus is really collected under the skin in this tunnel, and that pressure is what causes the pain. So for me, using this loop cautery and really opening this area up, it releases that pressure, it releases that pain, and the goal is to prevent that tunnel from reforming again. Take a little break from that. You're doing awesome. I like it. So what I've done is successfully de-roofed this tunnel that's on her left armpit. As you can see, I'm not stitching this up because you want it to heal in an open position because then the tunnel won't be there. So let me show you. Took off this cute little, that'll look much nicer. And then over here, we got rid of these. That'll heal really nicely. And this is where it's gonna be the main drain, probably right here. Okay. So that looks nicer already, you know, baby steps, right?
I'm really happy right now that I got some type of treatment, and I'm really confident that it's gonna work. And I'm happy that Dr. Lee was so nice to me, her and the nurses. I just couldn't believe how nice they were.
See how we open that? So by doing this, we're taking that whole top part off and exposing it so there's no tunnel. Right. So if that heals from the underside and the edges, it should heal pretty flat there.
The scars will be way better than, you know, having pus and fluid coming out of my body all the time. So scarring to me is nothing.
You did really great. I think you're gonna see that it's gonna do really well. In the meantime, we'll get you started potentially on a biologic medication that can help this more heal you from the inside.
It's nice to finally have a doctor like Dr. Lee to give me a procedure that's hopefully gonna work, and she believes in it, so I'm confident that I believe in it too.
Okay, I'm gonna start like kind of small. Really try not to disrupt stuff underneath and cause anything to bleed unnecessarily. I'm here with Virginia, who has this lipoma on the back of her neck. She's had bad reactions to epinephrine, which has been added to numbing medication before. So I'm using the Tumescent technique to numb the area, but it is without epinephrine. So I have to be extra careful and extra diligent to control bleeding. Oh, I see our little friend. A little buzzing sound you're gonna hear. I just wanna be extra cautious with you. Gonna see if it'll squeeze out. Sorry, I might have to buzz you just a little more. I need to keep control of a little oozing here. This lipoma is not coming out easy, and it is bleeding more. I find myself using a lot more gauze. I can't remember the last time that I've done a surgery without using epinephrine, and this makes me appreciate it so much more. We're really close now. I feel like we're taking out as many pieces of lipoma as you have foster kids. All right, that feels good. Feels pretty good. Putting some stitches in. I was able to get out all of Virginia's lipoma and zap all the blood vessels that were oozing along the way. Now I'm gonna stitch her up and send her home so she can focus on her really busy life fostering all those teenagers. I'm so glad that Virginia was able to overcome her fears and come back for a second visit, because a second visit is a charm. See your friend here? You can feel these, see the bumps on top?
As I'm feeling the lipomas, I'm so happy that I'm touching them outside of the body and not inside. This whole process has been a roller coaster ride for me, but because of Dr. Lee, having the surgery was safe and comfortable.
So you can see.
Ooh, that's it.
Hopefully the stress went away with your stress ball.
I'm very excited that the bump is gone after 20 years, and now I can live a normal life. I won't need a stress ball anymore. I plan to enjoy life into the fullest with my foster children. Thank you, Dr. Lee.
Whew. All right, so I'm gonna be a little bit more conservative right now. I just wanna see, because if I feel this is connected to any muscle underneath, I mean, we're gonna have to just stitch you right back up here. I'm here with Steven, who has a very large lipoma on his back, and I'm not quite sure whether it is attached to the muscle at the base. And if it is, that's not something that I really wanna mess with. All right. Still can't feel how connected it is underneath here. Let's see now. I can ease him out of here. Just gonna feel me pushing and pulling on you. Nothing, again, should feel sharp. But let me know if anything is unusual to you. Makes a lot of noises. You know what I liken it to? It's a lot like the ketchup bottle when you can't get that first ketchup out because there's suction, you know, like if there's no air in there. Lipoma is noisy. You might be able to get this out whole. You okay?
Mm-hmm. Just trying to stay awake.
Oh, you can fall asleep. Oh my gosh, you can totally fall asleep. If I get someone to snore in here, that's awesome. I'm really happy that this lipoma has this really nice pseudomembrane. It's really well encapsulated, but the deeper base of it is really bound down, and I'm worried it's sort of like this octopus with all these arms, and where are these arms going? Like, where did these arms end? I don't know how long they are, and I don't know how deeply they spread. He's definitely planted his roots. A third of him out, and he's just looking at us, going, what are you trying to do? I can kind of tell like where the older lipoma is because it's like a different color. It's like darker. Like it looks older. I think we see the old grandpa of this lipoma right now. The older part, it looks a little more gristled, a little more older and yellow. I feel like that's where I'm coming to ground zero of the lipoma. Possibly the part that has been there the longest. Maybe it's the most attached to his body.
Doing okay, Steven?
You okay? What's up? You sleeping? Are you sleeping? Yeah, okay, I woke him up. Dang it.
Nia, sorry.
No, I'm glad you are. I was just making sure you're, breathing. Pretty much all the sides are out, but he's pretty tangled. He's like at that edge where you're like, that fishing line, do I just toss out the whole fishing line or do I try to untangle it? This lipoma is really frustrating because it is still stuck at a pretty wide base and I can't see what's going on there because a lot of the lipoma that I've pulled out is now obscuring the vision here because it's really wide and spread out. The good news is the lipoma does not appear to be under the muscle, but it's sort of like I need to cut the head off of this octopus to be able to see where all the fingers are projecting. And I think he's got more than 8 legs. Sure he doesn't fall on you, that's your goal. Because I'm about to detach him now. Okay, why don't you carefully lift him into that tray. And then leave everything in there, because don't touch it, because it's not sterile right there. But it says here 3 pounds.
Always felt heavier.
Yeah?
You got something fighting back there?
Yeah, he's fighting us.
It's like when your jewelry gets tied. You're untangling it.
That's a good example, yes. Okay, we got it all. Yay, you should have told me you were a tough one. It turns out that it was very helpful that I cut the head off of this octopus so that I could see what was going on underneath. There is a lot of bleeding down deep at the base, and I have to be really meticulous about cauterizing any blood vessel that bleeds to help control bleeding. And pair this with some really strong sutures to keep this nice and tight. In case a hematoma forms, I don't want the stretching of that to rake open this area. So really firm stitches and good compression is really important. It looks good. You want to take a look? It's a little bit depressed there because there's numbing all around the outside.
Oh, man.
That looks good.
I'm just relieved. I'm happy. Definitely a great feeling.
Yeah, as Dr. Lee was working on me, I was feeling some tugging, but she made me comfortable enough to where I could actually just fall asleep. I mean, it was smooth sailing. She was awesome.
It looks really flat. Now you can say it's like a shark bite or something. Okay, she's gonna put a bandage on you.
It's definitely a life-changing moment for me. Can't be any happier than I am right now. And now, I mean, I might just run around the block with just a tank top on, man.
All right, so you shouldn't feel anything other than us touching you. You don't have to look or anything. We'll look. Okay?
Oh, I don't intend to.
Little baby
Not
pinches
at
here.
all.
Little pinch,
I can
sorry,
feel
pinch.
that it's numb, but I'm also getting scared.
You doing all right?
Yeah, I feel it.
Feel sharp? I mean, does it hurt though?
No, I just feel that it's cutting.
Okay, good. I want to make sure I'm not hurting you. That's the whole point.
Oh,
so.
no, I probably would have jumped.
Yeah, you would jump probably.
Or the leg would have gone up. That's usually my thing at the dentist, when the leg goes up.
Just gets wet, that's all, because we bathed it in a lovely little bath of saline, of cold saline.
Well, thank goodness. If I didn't know it was water, I would be, oh my God.
It does make your mind go a little crazy. That's why we definitely tell you about those things.
Nobody likes the sight of blood. When I was a kid, I had a nosebleed. And it was a horrible nosebleed because a blood vessel broke.
Oh.
So I couldn't put my head back because I was choking on the clots.
Oh, that's scary.
I hope I'm not talking too much.
No, we want you to talk, because then you know that you're doing all right, right?
And I'm still here.
That you're still breathing.
Yeah.
I love that Catherine is distracted, but I don't think uncontrolled bleeding is the best topic of conversation right now. The good news is that I've been able to tackle a lot of the underside of this lipoma while Catherine's been chatting away. I don't want to be yanking anything besides the lipoma out of here. You're doing awesome. We almost have it out. I'm just being very, very gentle because you're so thin.
You don't have a lot of buffer here. It's almost all teased away.
But you're right, you don't feel it at all.
That's good. That's what I like to hear. Just trying to ease out the last little bit that's tucked under here.
I'm not gonna believe this.
You're not gonna believe it? You're here, you should believe it. Looks like the shape of Kentucky.
Oh, thank you so much. And my joke was I'd lose 5 pounds if this came off, but I don't think it was a 5 pound.
I think it's gonna be more like you're gonna lose 5 ounces.
5 ounces?
Yeah, I don't think it's...
It was so, you could play with it. It was so pliable.
You can play with something that's 5 ounces.
Yeah,
you know,
5
it's probably
ounces.
like these guys. It's always bigger than they think it is, you know what I mean? Sorry.
Catherine is such a champ. I was able to successfully kick out this Kentucky-shaped lipoma without a hitch.
You want to see what we took? Take a look at your arm.
Oh my goodness.
So you hit that underneath there, right? You got that sexy arm back.
Oh my God, I'm looking at my arm. And it's, where the heck did that go, that big lump? It's like, it's almost completely flat. My arm is almost completely matching my other arm. It's gonna be a pleasure to wear my short sleeve clothes again. I'm excited to dress like summer in the summer.
That looks good, huh? It's gonna...
Oh, thank you.
Really great.
Now, I can just go out wherever I want. It's gonna feel great, not having to think twice about where I am and what's on my arms.
It was so nice to meet you. You're an absolute pleasure. You're not nervous anymore, right?
No. Dr. Lee is so patient, so gentle. She has a wonderful way of just helping the patient totally relax. My arm is back to normal. This is life-changing.
Let me see what you got here. I'm here today with John, who is the most lovely blind gentleman. He has a history of retinoblastoma. Now, because of his history of retinoblastoma, this may mean that these bumps are more than just a benign growth. So today, I decided that it would be best for me to really tackle one of the bigger ones and see what's under there, see what's going on, if this looks like something really dangerous or suspicious, and also just see how he handles the surgery.
We have regular fat here. Let's see if we have a lipoma.
This is not so bad. This looks like a very typical lipoma. It's not super firm or hard. It doesn't appear to have scarring, no funny textures or colors. But the thing is that it is tough in the sense that it is really caught up in here. It's really tethered in this fine, fibrous netting.
It definitely is not one like full sac, actually. It is kind of wound in with other regular fat. So as you can see, it's like in these little fibrous like net. It's like in this like netting, you know?
Right.
So I'm just trying to free it from there, and I'm also double checking, making sure none of that netting is anything that I, make sure I want to cut. A little bit of pulling and stuff here. You okay?
Yeah.
I'm just pushing. I just don't want to push on your chest too hard.
I'll let you know.
Okay,
Don't worry,
please
Doc.
do.
Oh, this is good. This is good stuff. That thing is awesome.
There you go.
John,
Your heart is on your chest now, for real.
Is it
Look
really?
at
The size of that thing.
John might have a pretty hairy chest, but he also has this netting of almost hair underneath his skin. So I was able to free this lipoma from this like fibers that were holding it in.
You know, it's had a lot of years to make it its home,
Yeah,
so.
you're gonna be sad a little bit about it, I'm sure.
No.
No.
It's gone, John.
Yeah,
It's gone.
Let's take a look at
Yes.
that. I mean, look how small we made that opening, too.
Oh, my goodness.
All right, that made me feel good about this.
It took a little work to get this big bump off of his chest. It was stubborn. It was tough to remove, but I was able to get it off and give his chest a nice, flat, normal contour. So it's really nice that I can take this huge insecurity off his chest.
Almost there.
Goodbye.
The tissue from this growth on his chest, I'm gonna send to the dermatopathologist to have them read it. Let me see whether this is benign or whether it is not, and that will really help me to decide how to proceed properly.
I'm gonna lay a piece of gauze over there to block it if you want to feel.
Holy
Schnikes.
Nikes.
That's his
Holy
word.
rainbow
Oh
cookies.
my God. It's gone.
It's unbelievable now to feel the difference in not having this lipoma in me, just taking up so much space. I haven't touched my body being flat like this in forever.
Oh my God, John, this thing is so funky looking.
I mean, I've thought I had an idea of just how large it is, but now being able to touch it, it's unbelievable. I can't believe this came out of my body.
I want to do anything that I can to help John, so I think I'm going to tackle these other lipomas. And the first one I'm going to do is this giant one on his shoulder.
Make sure I'm never hurting you, right?
Nope.
Good. Oh, here he comes. You okay?
Mm-hmm.
The first and largest lipoma has been removed. Now I'm gonna tackle the one that's really wrapped around his neck.
It's like a lobster. A piece of like a lobster tail.
God, it really, yes.
Thankfully, the second lipoma kind of slipped out like a beautiful little lobster tail. And now I'm gonna tackle the third and final lipoma for today on John's forearm.
Oh, there he is.
So now that I've removed 3 more pretty big lipomas, John can go home feeling a little lighter.
I adore you.
Thank you.
You're so much fun. I can't wait to visit you.
The boost that it's going to give me for self-confidence and my self-image can't be spoken, enough.
I'll be talking to you. So nice to see you again. Can I give you a hug?
I'm certainly happy to have had the lipomas removed by Dr. Lee. Am I disappointed that I couldn't get the ones removed from the neck? Yes. But the story's not over, I don't quit.
So I'm gonna do one here first, just to see. You okay?
Even though it's on me, I still don't want it to start squirting everywhere.
I don't want it to squirt either. You've got butter in there. But we're gonna get that little sack out there too. Because they're so oily though, they kind of get like slippery for me. One down.
I would like to see one of them.
Sure, I will show you.
Ew, look like a snake coming out.
Yeah, it's like a little ribbon.
Oh. That
like
was
your reaction.
liquidy. It looks like lotion.
Mm-hmm. Lotion or like some vanilla pudding. Oh, that was a good one. This one's more like linguine.
So far, so good. Lynette is actually enjoying a little bit of what we're doing. I'm removing so many of them so far, and she's kind of maybe enjoying how we're likening them to all different kinds of food. But I still have a lot more to go. I've got a lot of snipping, a lot of undermining, a lot of pulling, and let's hope that I can get all of these popped before I get too pooped.
That's gonna be okay here. Take a look. Obviously, then we're gonna let those little lines heal. That looks good, right? You're
It
seeing
looks
that.
awesome.
We're gonna move to the upper part, okay?
Okay.
Heal. That was a cute one. It's like a dressing on a cake. You wanna watch this last bit? This is the last bit here, okay?
Oh, my. That's a lot in there.
I know. It's like interesting how much is trapped under there. Okay. Everything looks great.
Okay, I'm finally finished. I was able to tackle pretty much all of the ones on her abdomen and on her chest. I removed all the sacs. They're not gonna come back, so I'm really pleased about that. Most importantly, I'm so happy that I can give Lynette the confidence back that she was lacking because of these Steatocystomas.
Now you can wear that low cut all the way down to your tummy.
Yes, it's awesome.
I've had these bumps on my skin for 10 or more years, and to be able to look at my body and see them gone, it's a sense of relief.
See you later. Thank
See
you.
you later. Thank you, Dr. Lee. I can live a normal life again.
This is exciting.
When I get home, I'm gonna do a shopping spree. I'm gonna wear a two-piece, little halter top, little shorts, and most definitely gonna have this stomach sitting out.
Okay, so I'm gonna put a little numbing here. I just wanna take a peek and see what goes on here on top.
I don't know whether this is a cyst or a lipoma as I begin. And it's in a really delicate area. There's not a lot of room for error. So I'm gonna take a little peek and see if I can discern this early on to help me decide how I'm gonna proceed. Okay, it's a cyst. How did you have a 30-year cyst here? My goodness, it didn't really change. I know enough not to bet money on these things. This one is porridge.
Cream of wheat, huh? There's a reason I never ate cream of wheat.
Oh, really? I kind of keep everything as pulled far away from your neck as possible. I think it's real close to your important stuff there, and I'm just trying to keep it away while I tease it. I've drained all the porridge-like contents out of this cyst, and so now I'm just left with an empty sac. So I have to gently tease this really thin, adherent sac away from all of his structures that I want to leave there. Okay. Looks like I detached it, and I can see the muscles of your neck, but I don't see your windpipe, nor do I want to.
I haven't been able to hit a high G in a while. Did you find it in there?
Jerry's cyst and the sac are out completely. So now I'm gonna stitch him up, and I think he's gonna be really pleased with these results. In fact, I'm hoping he's gonna be so pleased that he's gonna give me a little show outside. You look like 10 years younger. Ready, look at that. I see you do, look.
Wow, that's crazy. It feels like 30 years of weight has just been removed. It's just a pretty incredible feeling. This is something that is not only visually, but definitely emotionally life-changing. The next time I go on stage, I will hold my head up high.
My plan today is to attack from the front and move to the back. In the meantime, I want to keep the mood really nice and light for Amy. I know she's anxious, and we've got a few cysts here to tackle. I think that to remove this one on the front of her forehead would be a great way to start, because I feel like if we built up to that, it would make her even more nervous. That's a nice little pilar cyst. How long have you had this one?
Maybe 6 years? 5 or 6 years?
Well, you had your first baby there. Oh, well, that first baby cyst came out so easily. I love when that happens, when it just goes bloop. Let's hope this big one here, Donald Jr., the one that I named after her boyfriend, Donald, let's hope it's as nice as this little one was. Okay, now we're working on the big one, Donald. Let's see if I should squeeze this a little bit. Look, that is ready. Sorry. Okay. Sometimes I like it when cysts pop out whole, but I equally love it when you can pop and squeeze those contents out. You get to see the fruits of your labor, I suppose. Now I just have to make sure that the entire sac wall is removed in its entirety to make sure that this does not come back. Come on, Donald, let's go. Go, Donald. There's Donald. Well, that one was nice because Donald was well behaved and he came out whole.
Yay.
Right there. Okay. You must be really happy to have these gone. You've been thinking about them. They've been literally on your mind for a while.
Yeah, I've had these forever.
Good, looks good. Okay, now we're going to that last one that was the troublesome one, though. See, there's like another part over here, though.
Underneath again.
And there's like scar tissue right here. So I've tackled the first 3 cysts. Everything's come along smashingly well. But now I'm tackling the 4th cyst, and this is the one that has a little bit of a history. It has been damaged before, it has ruptured under the skin, so I'm suspecting that this one's gonna be the troublemaker. Oof. Oof. I'm sorry.
Yeah, that hurt.
I'm so sorry, it's the edge of it. Let me put some more numbing right there. Oof. I'm sorry, that's numbing.
It's like I think it got damaged and it sort of grew back in pieces. You have a litter over here. It's like buckshot here.
Opening up this last cyst for Amy is like opening Amy's Pandora's box. I mean, there are multiple little cysts balled in there, like quintuplets or sextuplets.
That one was a little harder to navigate. There was like a litter.
But it is really nice to stitch up this last cyst because her scalp is gonna be nice and smooth. Even Mini Donald is gone, so now she can be left with her lovely, sweet Donald by her side. The Donald.
All right, you wanna reach up and feel those back ones? Just make sure they're gone. It's like a magic trick.
Oh my gosh, that's so flat.
Yes, it took an inch off of you.
That's crazy.
You're gonna be a little shorter.
Touching my head for the first time and the bumps aren't there, it's life-changing. So weird.
We took off a little extra skin, that curly skin, and here it
That's
is.
huge.
Right?
Dr. Lee has helped change my life today by just helping free me, honestly, of all this worry and fear, and I feel like I can pretty much do anything now.
We kind of did a little funny thing. Because that one looks so much like your hair.
My doppelganger.
So one little pinch here, okay?
Cylindromas are dome-shaped tumors. It may look a lot like a cyst that you would see me remove commonly, but there's nothing to pop. It's just solid mass.
I need to make sure I can control the bleeding, so I might try to do this one first.
I really want to get this area flush to Elizabeth's scalp, but they're right on top of each other. I have to really delineate each individual stalk and try to remove each stalk one by one. The scalp is very vascular. It likes to bleed very easily, so the foremost thing in my mind is controlling the bleeding.
Okay, let me know if anything hurts. Okay?
Okay.
Yeah, it's so thick right here. Super dense. I can't see under there to be able to get to the whole thing.
The first cylindroma that I want to tackle is right on top of her ear. It really is tightly stuck to her, like it's so stuck I can't lift up and see under it.
I'm just gonna try to debulk this a little bit because I won't be able to see what's going on under there.
It's as if Elizabeth has a whole head of cauliflower stuck to her scalp. And so the first thing I'm gonna do is debulk it to be able to see what's going on underneath.
It's very vascular here. The nice thing about using this tool is that it cauterizes at the same time to help minimize bleeding, but it does like to ooze still. Wonder hand.
Oh, did you have wonder hands?
I'm gonna try to shave this down as flush to the skin as possible, but I'm really concerned about the bleeding, and that could really cause some problems.
What I'll do is let me get around here and take this part off here. Let me try to pull down myself here. Bring down here. Quite a production though, this one.
Removing that first cylindroma was definitely not easy, and if all of these cylindromas are going to be like this, this is gonna certainly take more than one visit.
But could I just cut this whole thing off with one quick thing? Because I do see that it's not attached too fiercely to the base here, or too widely to the base. I'm gonna try to lift this up, and I'm gonna try to go from this way, I think. Okay, so. Okay. Make sure nothing hurts.
The next one appears to be more pedunculated, meaning it's attached by a smaller stalk. It hopefully will make it easier to remove.
Going for a bigger one here. I'm gonna try to do it quick. It's so hard to get under there. I did not mess around with that one, I'll tell you that. Let's see. All right, hold that pressure. Do you think if I took that away, it's gonna ooze, maybe?
Yeah, when you move this gauze, it starts to want to bleed again.
Yeah, let me buzz it a little more. Yeah, I agree. I agree. All right, just a cute little nubbin left. I think we need to see how these two do here, because they wanted to bleed a lot. How the second one was better that I didn't take all of it off because it really started to bleed, and I can see some of these they're bluish, so they're filled with some blood vessels.
I think I'm gonna stop for now, but I am really proud of how well Elizabeth has endured this. The next 24 hours is actually where it's the most important. When some of this numbing medication wears off, it's not uncommon for people to really start bleeding.
I want to show you, actually. Straighten your
Ay, doctora Lee, gracias.
Yeah, a lot of it is better, huh? Because that's going to hide in the back.
Ay, gracias.
That's going to be much better.
Yes. Cuando la vi que terminó la cirugía, no podía creer que me hubiera quitado tanto. Quería que me hubiera quitado más porque me sentía muy bien. Pero si ella dice que no, pues se respeta. Thank you, Dr. Lee. Thank you so much.
Mucho gracias. No, that's not what I say. De nada. Yes, I said the right thing. Okay.
After a few months, Elizabeth's initial wounds healed up really nicely and didn't bleed too much. So I brought her back to the office to remove more of those big cylindromas.
Are there?
Okay. How about the next one?
The second procedure went really smoothly, and I think when these spots heal, Elizabeth is gonna have a really nice improvement.
Uno, dos, tres. Much better.
Thank you.
A little baby pinch here, okay?
Because I'm not really sure exactly what's going on Jamal's tush, I'm going to use the Tumescent anesthesia technique. This is where I inject a dilute numbing solution under there, and that's gonna help create a cushion or a little space potentially between this growth and any of the other deeper important structures so that I can separate it from his real tush. I hope that when I make my first incision, it looks like a standard lipoma. I don't want it to be any strange colors. I don't want it to be any strange textures.
All right, let's take this booty off your booty.
Yeah.
Let me just take a little peek first, just to see what you got here. Well, it is definitely fat. Looks like a lipoma, looks like a pretty normal lipoma. Just a very septated lipoma. As you saw, you know, how it had these little dimples in it. Can you squeeze that and just pop it out?
I wish.
Right? It's almost.
Mm-hmm.
It's stuck.
Not gonna budge, yeah.
It's like a sea anemone. Anemone. You got a beautiful butt flower going on right here.
My butt's very romantic.
Yeah. Yes, your butt is romantic. I don't say that very often, you know. That's a compliment. You can take it. Why don't you take it from me? Thank you. Well, the bulk of it is gone.
Okay, well, this does look like a good typical lipoma, so that's the great news. But I do not want this thing to grow back. He doesn't want this thing to grow back. I'm trying to clear out the whole lipoma so I don't leave anything behind in Jamal's behind.
I think that it came out really well. It just was really tethered in there, but we got it. I don't know why the 9-year-old thing happened. I feel like it might be independent of what this is, but maybe.
It looks like I was able to successfully remove this lipoma. I'm certainly gonna send a sample of this to confirm that it's a lipoma and that it's not something more concerning, but I can't wait to show him his new booty.
All right, it's looking good. Okay.
Oh, wow. Never been so happy to have a flat butt. Oh my God. I feel amazing. I feel like a huge weight has been taken off of me.
Here's a little bit of skin we took off.
Whoa.
Your booty has never been this close to your face.
I don't know, after 24 years of dealing with this, I feel like a piece of me is now missing, but like a piece that I don't mind is missing. Ooh.
Yeah, you feel good.
I like that.
Yeah.
I actually
How we
feel
take things for granted. We can't just
Yeah.
sit normally, huh?
I actually feel like my back
It's
feels
already
better.
straighter. You're gonna stand a little taller no matter what. It was really a pleasure. I adore you, okay? And take care of that booty, okay?
Yes,
It's
I will.
a good-looking booty.
Thank you.
Dr. Lee, she has an amazing spirit. She made me feel really comfortable. And I'm really grateful for her that she was able to remove the lipoma. Now that this lump is gone, we're gonna be able to be in the studio all the time, sitting all day, making music comfortably.
Thank you very much.
Okay, let's see what you got here. Make sure I'm never hurting you, like I said. You okay?
I'm fine.
Good. It's probably a lipoma, I think.
Omar's growth feels a little more soft and jelly-like, so I'm gonna go with a lipoma.
Maybe not. Maybe it's a cyst. I think we got ourselves a cyst.
I was wrong.
Your wife was right. You know what? I bet she's gonna say that. I'm always right.
She definitely is.
Does look like a snowball under there. Okay, let's do this. There's snow in there. Take all that from you. Look at this, you did it. You were waiting for over a decade with this. I will just take out the little sack so it won't come back. You okay?
Yeah.
Just hear me up here. Like a little mouse. I'm like that mouse from that 'Twas a Night Before Christmas. Not a creature was stirring except Dr. Lee like a mouse.
Thankfully, that was a nice, obedient little cyst, not a mean lipoma. And I'm gonna leave him with a flat little scar hidden in his forehead lines. Omar's gonna look fantastic from here on out, not just at Christmas. Don't people wanna look great all year long?
That's crazy.
You're gonna look good. Watch out.
That's crazy.
It's looking good.
Thank you.
Oh, you're so welcome. It's a pleasure.
When I looked in the mirror, that was the first time I had seen my head flat in over a decade. I was shocked. Since the bump's gone, I will be a lot more personable, and I feel like I'd be a little more willing to celebrate Christmas with my family.
Yay! It's right next to the scar. I think it was tugging on you down deeper. I can see why that made that sore, actually, after the last ones. Okay, I'm sorry.
I'm here with James, and I'm tackling this cyst on his jaw. This is a really delicate area, so I've decided to make a little nick in the surface and really squeeze out some of the contents first. I just want to make this as small and as quick of a procedure as possible.
Feeling okay?
No, I know, I was just breathing.
Good. Keep breathing. We almost got it all.
That's good.
Yeah, we do. And it's in a nice, intact sac. That's what I want to see.
I was concerned that because of recent inflammation, that the sac wall may be breaking down. But the fact that it's intact makes me feel much more confident that we're gonna be able to remove this entirely.
The cyst is out.
Good deal, thank you.
It's all gone under there. Okay, we're just gonna put some stitches right here.
Fortunately, I was able to remove this sac wall in one entire piece, which is always wonderful. And now I'm just gonna hide this little scar right in his natural smile lines.
It's like that.
Oh, well, it looks great, yeah.
See, we try to hide it in there, but we got it all nice and flat there.
Yeah. I think she's done a good job. Oh, I don't think I'm gonna have much of a scar there. It looks really good, better than I was expecting it to look.
Okay.
Thank you,
Take
Dr.
care,
Lee.
okay? This is Dr. Song, by the way, Ricky.
Big bumps like this don't usually come out very easily. So it's really nice that Dr. Song is here. She's the future of dermatology. I get a little extra help. She gets a little extra training. It's win-win.
And of course, you know you're the boss, right, girl? Let me know if anything ever hurts, okay?
All right.
Okay, so I think this is a lipoma. The way that I saw it, like how it kind of hung down a little bit, was a clue to me, and it was pretty mobile. Right now it's a little stiffer because we did tumescence.
Dr. Lee moves fast, and I try to soak in as much as I possibly can.
You can actually push around, and you could see how we like undermine with our fingers, right?
Yeah, pretty well circumscribed. This is great.
So I'm just pushing around, make sure I'm not hurting you. The tumescent allows me to really be able to take off the little adherent. Yeah, so it looks like a lipoma. How do you feel about that? Are you excited?
I am excited.
Okay, why don't you give it a little squeeze gently there.
Okay.
Oh, good. Yeah, that's fine. There we go. Isn't that cute? It's like a baby. Betty here just had twins.
So I'm pretty good at catching babies right now.
It's so heavy here. Get your hold on to it too. Thank you.
Working with Dr. Lee is really exciting. There's things here that I've learned that I never got to do in training before. And so to have her teach me along the way is just a complete blessing.
Have that little area underneath it. That thing's heavy, isn't it?
Right.
Dr. Song just got to experience one of the most beautiful, smoothest pops ever. It was so pretty and shiny. It was marbled like a bowling ball that was just recently buffed. I just hope she doesn't think they all pop out this easily.
It's really heavy. Wow. Yeah, right? That took off some weight off your shoulder, making you walk a little crooked.
It was almost the size of my child's head when he was born.
1 pound, 1 ounce here.
I feel relieved, I feel grateful, and I feel a pound lighter.
Looks good, huh?
Oh, wow. When I got to see my shoulder, I just felt so much relief. I'm really excited about this Christmas this year because I'm gonna be able to put the decorations on the house. I'm gonna be able to help decorate the tree. I'm just gonna be more involved than I've been able to be in the past.
You did awesome. Take care, okay? Happy holidays. Merry
You as
Christmas.
well. Merry Christmas to you guys. It's gonna be a great Christmas this year. My excitement alone is going to make everybody around me excited, and that day is just gonna be a really great day.
Oh my gosh. That's nuts. That's huge.